I'd like to open the Commissioners' open session for Thursday, May 16th, and as we always do, we'll start with the Pledge of Allegiance and a moment of silence.
Pledge allegiance to the flag of the United States of America and to the republic which stands, one nation, under God, indivisible, with liberty and justice for all.
And for Priority Carol, we actually have three sets of things, and the Maryland Police Week will be our starting place, which came up late and was not on the public agenda.
I take full responsibility for that, so I apologize. But I thought it was
No,
important
you-
that we...
You thought of it.
Whatever.
So, gentlemen from Sheriff's Department, Corrections, any law enforcement, anybody who wants to come down to the front, please do so.
Good morning, all.
Morning, Commissioners.
Morning.
So we have a proclamation...
Nobody wants to sit next to you? What's
No one
going on?
wants to sit next to me.
Yeah,
I guess. I
no.
don't take it personally. It's,
Oh.
as you know, as you ascend in rank, people kind of start to gravitate away from you.
Call it like it is.
Well, thank you all for joining us this morning. To recognize National Police Week 2024 and honor the service and sacrifice of those law enforcement officers, including correctional officers, killed in the line of duty while protecting our communities and safeguarding our democracy. Whereas there are more than 800,000 law enforcement officers serving in communities across the United States, including the dedicated members of the Carroll County Sheriff's Department. And since the first recorded death in 1786, there are currently 24,067 law enforcement officers in the United States who have made the ultimate sacrifice and have been killed in the line of duty. And the names of these dedicated public servants are engraved on the walls of the National Law Enforcement Officers Memorial in Washington, D.C. And 282 new names of fallen heroes are being added to the National Law Enforcement Officers Memorial this spring, including 118 officers killed in 2023 and 164 officers killed in previous years. And the service and sacrifice of all officers killed in the line of duty were honored during the National Law Enforcement Officers Memorial Fund's 36th Candlelight Vigil on the evening of May 13th, 2024, and May 15th is designated as Peace Officers Memorial Day in honor of all fallen officers and their families, and U.S. flags should be flown at half-staff. Therefore, be it resolved that the Board of County Commissioners of Carroll County will observe May 10th through 16th, 2024 as National Police Week in Carroll County, Maryland, and publicly salute the service of law enforcement officers in our community and communities across the nation. God bless all of you, and thank you for what you do.
Thank you. And Commissioners, I apologize. Sheriff DeWeese is down in Montgomery County for the Maryland Sheriff's Association meeting today. And of course, you know, in my 22-plus years of law enforcement, I've never met a police officer who's done this job or signed up for this job for any sort of recognition. We simply do it because we care about our communities and the public and the people we serve and we want to help. But I'd be remiss if I didn't thank you for recognizing those men and women of law enforcement and corrections who have made the ultimate sacrifice while doing their job and are not with us any longer. And I appreciate this large crowd that came out to celebrate the Law Enforcement Corrections Week.
I want to thank you guys and tell Sheriff DeWeese you guys covered for him well. I'm biased. I love Carroll County. I think we're the safest county in the state. We see some of the activities you guys go through before the public sees it sometimes, and it's just amazing some of the idiots you have to deal with, and that you stay safe. So I just want to thank you for what you do.
Well, we certainly couldn't do it without the obviously the financial and ongoing support of the Board of Commissioners, but also the wonderful support that we get from the citizens who live in this county, who work in this county, and who travel through this county. I'll tell you, I worked at another agency before I came here, and the citizens that are in this county and that I've dealt with every day since I came here are just fantastic, and we love each and every one of them, and we're proud to serve you, the county government, and the citizens that live, work, and travel through the county here. Thank you.
Any of you others want to comment, or, just want to share, just very quickly, thank you. And sometimes folks that wear either blue, red, or green don't believe that they have done enough because they have not put themselves in harm's way, and they have not given a sacrifice that unfortunately some have. To me, it's as soon as you raise your right hand, you're willfully putting yourself in a position that becomes very selfless to serve our community. Again, whether you're wearing blue, red, or green. And at that moment, you're giving up certain rights, and we know that. Our inalienable rights are taken away from us to ensure others have theirs. That's huge, and that's something that you should always hold on to. This is, opportunity to memorialize those that have given the ultimate sacrifice, but it's also time to reflect on why you're doing what you're doing when you raise that right hand. So from me to you and the sheriff and the entire department, thank you.
Commissioners?
I've read the proclamation. I'll just say again, thank you from the bottom of my heart for what you do. We could not exist without you, and I sincerely mean that. Thank you, and God bless all of you.
Well, I would just echo the same comments as my colleagues, but I will say that, we do get to see some things that occur, and, those of us up here do understand, not to the lengths that you do, but we do appreciate what you do. I know for a lot of people, they may see and tend to think that your day is kind of routine, but your day is never routine. None of you know what you're facing the minute you walk out of your homes in the morning, leave your families. And, I think most, if not all of us up here have taken ride-alongs with the Sheriff's Department, and it's been very eye-opening at times, some of the things we run into, or you run into, and we just happen to be along. But very appreciative, and you are the reason we have an incredibly safe county. And I know some days it may seem very typical to those of us that live here, but we really do, not just from us, but the public, thank you for all that you do, and it's greatly appreciated.
Yeah, ditto. Some of the best things, maybe the best things that are happening in Maryland are happening in Carroll County, and it's because of people like yourself that is the case, because you're protecting it, and I really appreciate it, and thank you very much.
Cool.
A photo?
Let's do it.
You want to
There's
stand back
enough of
here?
them. Do we want to stay up here? Do you want to take them their proclamation?
When you all come up here, we'll stand back here. Matt comes out of the magic door, takes a picture. Everybody smiles.
Hey, Matt, have them move around if you can't see all the commissioners.
Thank you.
Thank you guys very much again. And for the record, several of you were the quietest I've ever seen you. Not you.
Nicely done. Thank you.
Thanks, Sarah. Okay, who has, you have the EMS?
Sure, yeah, I'll go. Before I get started, if we've got some of our county station personnel anywhere in the room here. So we've got a couple folks, maybe there's some people out in the hallway, I'm not sure. But I'm going to say a few words about Emergency Medical Services Week. Thank you, gentlemen, for coming. And Chief, you look very sharp. Very nice.
Are you here for the older American? No, I'm kidding.
Age
Okay,
discrimination.
I better get started. This is just, we got to keep moving here. It's going to be one heck of a day. All right, so Emergency Medical Services Week is May 19th to May 25th, and it's actually the 50th anniversary. Emergency Medical Services Week. Emergency medical services is a vital public service, and the members of emergency medical services teams are ready to provide life-saving care to those in need 24 hours a day, 7 days a week. And access to quality emergency care dramatically improves the survival and recovery rate of those who experience sudden illness or injury. And emergency medical services has grown to fill a gap by providing important out-of-hospital care, including preventive medicine, follow-up care, and access to telemedicine. And the emergency medical services system consists of first responders, emergency medical technicians, EMTs, paramedics, emergency medical dispatchers, firefighters, police officers, educators, administrators, pre-hospital nurses, emergency physicians, trained members of the public, and other out-of-hospital medical care providers. And the members of emergency medical services team, whether career or volunteer, engaged in thousands of hours of specialized training and education to enhance their life-saving skills. And it is appropriate to recognize, therefore it is appropriate to recognize the value and accomplishments of emergency medical service providers by designating the Emergency Medical Services Week. Now, therefore, we, the Board of County Commissioners, do hereby proclaim May 19th through May 25th as Emergency Medical Services Week. And thank you both gentlemen for joining. For people in the room who don't know who's here, this is Chief Michael Robinson. He is a director and chief of our Department of Fire and EMS, and we've got Lieutenant Karolinko, one of his lieutenants, that are here as well. So thank you, gentlemen, for both being here. Obviously a very pertinent topic here in the county, but if you'd like to say a few words about where we are and how we're getting better.
Yes. First, I thank the commissioners for the proclamation. The theme of this year's EMS Week is honoring our past and forging our future, which is significant here in Carroll County. We're completing our first year of county staffing with county employees of our emergency medical services. During EMS Week, Carroll County Hospital is going to have a little event for us this week. More significant is in the past year, we have saved the lives of 39 people who were clinically dead when we arrived with our paramedics. We're going to honor next week each of those responders who are responsible for saving their life. And when I say saving their life, we looked at all the cases and we found 39 times where patients were clinically dead, resuscitated at the scene, definitive care at the local or regional hospitals, and actually discharged. So we're going to honor the saving of those 39 people. And as the proclamation says, EMS is not just paramedics and EMTs, it's a comprehensive system. It starts with the 911 dispatchers, includes first responders such as firefighters, and then our actual EMS transport units and our ALS chase cars, all that have been implemented in the last year here in Carroll County. Thanks to the efforts of the commissioners, the FY25 budget will allow us to have 16 24/7 units, all staffed with paramedics. In addition, I want to recognize our medical director, Dr. Stephanie Kemp, our assistant chief of EMS, Eric Zaney, who work every day in the areas of quality assurance, education, and in system-wide management. Some of our current initiatives, we've just trained our paramedics at the University of Maryland Medical School, and our paramedics can now perform surgical airways, which means if we're unable to pass an endotracheal tube, we can actually perform a surgical procedure known as a cricothyroidotomy, where we can actually cut in and secure an airway. We're also in the process of adding ultrasonography, which is an imaging technique whereby our field paramedics will be able to detect certain bleeds within the body, and in particular being able to identify aneurysms, which will allow us to take patients to the appropriate facility for immediate surgical intervention. Our new technology that we'll be purchasing this summer, state-of-the-art monitoring equipment, all Bluetooth capable, will allow us to continue doing 12 lead EKGs at the scene, but we'll be able to do something called a 15 and an 18 lead EKG, which will definitively allow us to diagnose acute myocardial infarctions or heart attacks, and in partnership with Carroll Hospital Center, which is a cardiac cath site, we'll be able to get those people from the onset of their chest pain into the cath lab within 30 minutes. And I'll mention that former Commissioner Steve Lance was actually saved by our people last year because of our ability to do that quick diagnostic procedure and get people there. So we are thankful to the citizens of Carroll County for supporting our initiatives in EMS, and to the ongoing tremendous support of you all, the county commissioners, to move our system forward. So it's an honor to receive this morning.
Thank you. Lieutenant?
I just try to be more brief, Colonel.
Serious?
However, you know, we're at a unique period in the history of our EMS service, our fire and EMS service here in Carroll County. You know, we have a portion of our career staff that were corporation employees before. You know, decades of service in some cases. I'd had 8 years with the corporation employment before we switched over to DFEMS. And at the same time that we recognize and we have the institutional knowledge and dedication of those individuals, in the last year we've brought in a significant amount of new faces, clinicians that have brought varying skill sets, backgrounds, experience to complement that already, you know, existing cast of characters. And it's been really cool to watch that take place. You know, the chief did an eloquent job of highlighting everything, so I don't want to be redundant, but I certainly want to point out, you know, this is a combination system. And, you know, while the career staff are doing all the fire and EMS things, the volunteers are there doing fire and EMS with us. And in the last year, and even more recently, we've seen a lot of significant rescues and extrications that have happened, fires, you know, some rescues out of some burning buildings, things like that. That collaborative nature of those old new faces on the career side, but the system we have now with, you know, obviously the volunteer interface, everything else that we have there is delivering a high level service. I want to reiterate just the improvements. You know, look at Dr. Kemp coming into this scenario, what she's brought to the table for us, our relationship with Johns Hopkins and their medical direction has taken us to another level that we hadn't experienced previously. We have real tangible improvements that are in the county right now, and we'll continue to build on that as we go forward, you know, assessing needs, vulnerabilities, but also the successes, recognizing them and building on them to provide a top-level service to the county and the citizens, visitors, businesses, all of the above here. So thank you very much for your support here. Of course, we look for your continuing support always, but, you know, this is a great opportunity to recognize the achievements so far.
And thank you guys for what you do, and you mentioned a lot, but I think people need to realize also, for an ambulance to show up, you need HR, you need management,
Absolutely.
you need a lot of other things and you need somebody to analyze the data and tell us what we're doing wrong and what we're doing right. There's a lot of things behind the scene too. And I know I had said to a couple, if I'm laying on the ground, I'm happy to see the ambulance and the EMS, but I need to recognize they might not be there without all the others. So thank you for all you do. Commissioners?
I'll echo that as well. You know, thank you very much for what you do. And I think, Chief, it was important that you talked about the kinds of services that we're expanding and able to perform at this point. It's always a good refresher from myself that, you know, it's not just a question of an ambulance showing up somewhere, but all of the procedures and all of the skills that are associated with having to do that. It doesn't come cheap, and it doesn't come without the expense of some human costs as well, because I cannot imagine what it's got to be like for you guys on a daily basis to have to respond to a call, not knowing what you're getting into, and seeing and dealing with people at the worst possible times in their lives. So you're not just showing up to help them, but you're there to offer them a kind of sense of security and safety as well, that in this moment, at their darkest point in their lives, there's somebody here for them. And I thank you both for that, and I pray that God blesses both of you and everyone in this department and the volunteers as well in every single possible way.
Thank you. And also, I'd like to extend the invitation. We'll wait till after the budget's done, but for each of the commissioners to come out and spend a few hours riding on our units. And particularly, we get you with the shift commander, our chase cars, and we will assure you that you will get out there and see what goes on. And it's just something that everyone should have the opportunity to experience, to see how our crews work together seamlessly and all of the skills they bring to the table.
Yeah, Chief, you know, you started right off talking about team and the team that it takes. And the two of you as good leaders recognize that, and it's been amplified a little bit more amongst my colleagues. It really is a very extensive team, and just as I shared with the Sheriff's Department, raising that right hand, willfully doing the things that you do, whether it goes high speed from point A to point B, regardless of the weather conditions or the traffic, going into a building, not knowing who's on the other side of that door when a call is made, going into a fire situation. You're taking risk on each one of these issues, and you're willfully doing that to keep us safe and allow us to do the things we do as a community. It makes our choices, at least in my view, easier when it comes to funding, when it comes to spending the resources on the requirements that you put in front of us, because without it, we're going to be putting ourselves back in harm's way. So I think this is very timely, you coming to us and us being able to say thank you, just like the sheriff before. And the next proclamation is Older American Month, but we'll save that for another time. So, okay.
Well, gentlemen, I want to thank both of you for coming out. And, like was mentioned this morning, it's not just those of you that are out on the scene, it's the folks behind you that are doing all the work, be it the billing, all the research. And I think Lieutenant Karolinko said it best. I mean, it's not just the Carroll County Fire Department, it's all the other volunteer groups as well. And the one thing we've always done in Carroll County, and I think we all can be proud, anyone that lives here, is we do a very good job of working together. We might not always come about it from the same perspectives, but we try to figure out how to do what's best for the community. And I just truly appreciate all the hard work of you and everyone working in your department and staff. And I just appreciate all the departments, not just our Carroll County, but also the other individual fire companies, for everybody and everything they're doing to keep everyone in Carroll County safe. So I just want to say thank you this morning.
Can we get a photo? I think we can
Yes,
get
photo.
I think we can get in this one.
We can get in.
Okay.
We'll be on you. Yeah. Oh, yeah.
Thank you.
Thank you.
You're up.
Okay, and Commissioner Gordon's going to share one more with us.
Yes, we have one more proclamation this morning. We have a proclamation for Older Americans Month, May 2024. Whereas May is Older Americans Month, a time to recognize and honor Carroll County's older adults and their immense influence on every facet of American society, and the Carroll County Bureau of Aging and Disabilities has provided service to older adults in Carroll County since 1972, a total of 52 years. This year's theme, Powered by Connection, focuses on the profound impact that meaningful connections have on the well-being and health of older Americans. As they grow older, adults may begin to feel growing a sense of isolation from the larger community around them. It's important to remind ourselves of the transformational potential of community engagement and enhancing mental, physical, and emotional well-being. By recognizing and nurturing the role that connectedness plays, we can mitigate issues like loneliness, ultimately promoting healthy aging for more Carroll County residents by spreading the word about the mental, physical, and emotional health benefits of social connection through professional and personal networks, encouraging social media followers to share their thoughts and stories of connection using the hashtag Powered by Connection in order to inspire and uplift, promoting opportunities to engage such as cultural activities, recreational programs, and interactive virtual events. Through their wealth of life experience and wisdom, Carroll County's older adults guide our younger generations and carry forward abundant cultural and historical knowledge, and older Americans improve our community through intergenerational relationships, community service, civic engagement, and many other activities. And communities benefit when people of all ages, abilities, and backgrounds have the opportunity to participate and live independently. And the Carroll County Bureau of Aging and Disability reflects its commitment to inclusivity and correctedness by ensuring that older county residents have the resources and support needed to stay involved in their communities. Now, therefore, we, the Board of Carroll County Commissioners, do hereby proclaim May as Older Americans Month. We urge all citizens to take time during this month to recognize older adults and the people who serve them, and essential and valuable members of our community. Adopted the 23rd day of May, 2024, signed the Board of Carroll County Commissioners.
Well, thank you, Commissioners, for the proclamation. We greatly appreciate it. I'm joined today with Gina Valentine, our Bureau Chief of Aging and Disabilities, and then Rich Otone, our Community Services Supervisor, and that oversees all of our senior centers across Carroll County. We are just, Carroll County, we love our older adults. We provide so many different services and supports. All of you support that effort as well. And the theme for Older Americans Month this year is Powered by Connection. And I'm going to turn it over to Gina to talk a little bit about that, and then Rich will share with us as well.
Good morning. Thank you again for the proclamation today. I just wanted to say this morning, of course, it's important to recognize and celebrate our older adults, not only during Older Americans Month, but all year long. Their accomplishments, their wisdom, their experiences, and we support their independence and desire to age in place and strive to combat social isolation by offering social engagement opportunities through our senior and community centers, and also volunteer opportunities. We have many wonderful volunteers throughout our senior centers, and also volunteers that support our programs, such as our state health insurance assistance program and our long-term care ombudsman program as well. Our goal is to support healthy aging and connect people with the social engagement opportunities and programs and services to keep them in the community for as long as possible, because we know that individuals really, their desire is to stay in their homes, and that's our goal, is to help them do that. So I'm just going to turn it over to Rich for a few words.
Thank you. I just would to add to this, and we have over 5,000 members of our active members of our senior centers right now. Last year, we provided services in the senior centers to over 3,000 people. Those are numbers, they're easy to calculate, and that's what we share with you guys, and we share with the federal government as well. But there are a lot of stories behind those numbers that are absolutely vitally important, not just to us at the Bureau of Aging, but to the people whom our older citizens touch. Gina mentioned the volunteers at the senior centers. We wouldn't be able to do what we do at the senior centers without those volunteers. Older Americans now, especially in Carroll County, are not just people who are coming into senior centers to participate in bingo or get a congregate meal. They're actually still serving in leadership roles, whether that's as a volunteer or in a paid capacity, but they still matter in a big way in Carroll County, and that's only going to continue. Last week we presented our area plan. We've had numbers in there that will show you that the number of older people in Carroll County is only going to grow, and that percentage is only going to get higher. So it's real. This is an important time to recognize the things that older people bring to this county, and I thank you very much for doing that.
What is there a minimum age for the senior centers?
That would be 60. But if you have a disability, 50 or over.
Okay.
So you're not going to give me a hard time about that now?
I'm not saying a
Okay.
word about age. That's why he read this, not you.
Okay.
Well, I want to say thank you to you and to everybody who's part of the department and the senior centers of volunteer, everything that you do. My grandmother is in her 90s, and she is still sharp as anything, and she was doing walking club, and she's engaged because where she's living has these kinds of activities and these things to keep her involved. And so she is full-blooded Japanese. She married my grandfather after World War II, and to this day, she can fire off Japanese like it's nothing. And it's all about keeping your mind and your body as active as possible, and that socialization is so important, because when I go visit her, she'll say, oh, this is my neighbor such, and she does this, and this is somebody I worked on the garden with last week, and I do not know what I would do without my grandma. And, I look at it as, what you said as well, that there's a sense of knowledge and understanding and wisdom that, people my age and younger simply, you have to learn that over time. And for the life of me, and this is something I've always tried to figure out, for the life of me, I can't understand why there are so many people, especially younger people, who are so quick to dispense the elderly, right? They don't respect them, they don't think that they're worth anything, and I will never understand that for the life of me. Who we are, everything we are, is predicated on generations that have come before us, and I think that it is a blessing that people live as long as they do in this country, and that we have that wisdom and that experience to guide us in the present. So thank you for everything that you do, and God bless you.
So the difference between my colleague and I is his grandmother may be in his 90s, my mom is in her 90s. And she may not be full-fledged Japanese, but she is definitely full-fledged, or fledged, whatever the word is, New Jerseyan. And she lost the accent, kept that attitude, and boy, she knows every four-letter word there is, and still uses them, and she's very strong woman. I'm very proud of the things she does, and the reason she's able to do so much is because of the volunteers and the selflessness. The three of you, and you've heard me say this, in private and also in public, the leadership you provide, the charisma, the selflessness does not go unnoticed. It doesn't go unnoticed by me and by so many others. The volunteers, and you're always sharing how others are part of building this team, and it's so true. They just do an amazing job. The volunteers in all the centers and all the things we do. Nobody takes care of Carroll County better than Carroll Countyans, and this is a great example of that. So again, all I can really say is thank you for what you do. Continue to do it. I call you rock stars all the time, but that just means I try to give you more work to do. So we'll just say thank you at this point. So, got it.
Yeah, so another reason why this proclamation and what you do is so important is because for people who are, older people over their 50s and 60s, they're actually the backbone of a lot of the towns in our county. They're running the clubs, they're running the organizations, they're doing the fundraisers. I'm from Mount Airy, I happen to live in Mount Airy. They recently created a commission on aging and livability, and you look at their to-do list, and it's not just about older Americans, it's about fixing a lot of the things and bringing to light a lot of the things that are important. So when I'm down there in Mount Airy, I realize there might be a lot of older people living there, but they're also the same people that are doing everything. So, that's just the truth. And that's the same for when you walk into a lot of our fire stations in the county as well. We've got 14 fire stations in the county, and a lot of the volunteers are older Americans as well. They're getting up there. So it's not just about, and I'm not saying it is just about the proclamation, but it's about supporting the people who are actually out supporting the communities and doing, I would argue, an overwhelming majority of the work that's being done. It just casts an additional light on how important it is of what you're doing and how much we appreciate what you're doing, and how much it's really just truly a part of how our county is operating and why it's so great. So appreciate it.
No, I do greatly appreciate all the hard work your staff, and the volunteers. 52 years for the Carroll County Bureau of Aging and Disabilities is quite a long run. And obviously, over the past 5 decades, things have changed and improved via technology, other opportunities. And, to Commissioner Guerin's point, talking about older citizens being the backbone, those are where all these volunteers organizations started, be it the fire companies or nonprofits. And, we hear about it every day, and I know the public hears about it every day, which is we're losing a percentage of not just those individuals, but there's a transitional mindset in people volunteering, which is what has made this community and so many others great, because it was the people that made things happen. So it's always good when we see other generations stepping up and doing that. Our older members are just an absolute treasure of knowledge. One thing I am going to say this morning, which does kind of connect to this, for anybody out there that has older people in their life, neighbors, family members, whatever, yes, we've all heard the stories a million times about various things, them growing up, their experiences. If you have the time, video it, record it. It's nice to have it written down, but those memories will be gone at some point, and if you can save them and somehow capture them and that essence, I would highly recommend it. We're very fortunate. I know the Community Media Center does do things like this, but when we look at history of our community, our nation, whatever, a lot of times we think of all these big dates and places and events. Well, all of us are part of that. So if there is that opportunity, I would just say to everybody, please try to remember that, appreciate that, and try to document and keep that, because we do lose that every day as we lose people. And that's, knowledge and history we're never going to get back. So if there's any way, I would just recommend that highly. That's something I've done in the past with some folks, and I appreciate everything that you all do, and thank you very much.
And thank you again. It's such an important service to the county, and thank you very much. And I do want to mention, although he's not the oldest here, Commissioner Rothstein didn't get to read a proclamation today. We did get to do one yesterday. Thanks for lending your glasses so he could see it. I appreciate that. A photo?
Photo.
Thanks. Sorry. Anytime. You look good in their glasses.
You can borrow mine. Mine are pink.
Thank you.
I know. Yes.
Remember exit.
Okay, Priority Carol, each of the commissioners speak on what they've done for the last week. And before we do that, I assume people are here for public comment. We have 8 items on the agenda. Some have public comment, some do not. And if you want to do public comment for something not on the agenda, that public comment is on the agenda after item 8. And you need to fill out a card, and there possibly could be callers also.
Give them to me. And give them to me.
Yes, and give them to her. I'm sorry. And I'm not going to do my week. I decided last night, based on the emails we received, to read a statement at the beginning of this meeting, and I'll do the same statement at the beginning of our budget meeting. And I wasn't sure I'd see so many people, but I'm assuming different people listen to different meetings or watch different meetings, so I wanted to put this out. Based on over 300-plus emails, many of you have been conned by untruthful statements on social media and other places. At our budget meeting on May 14th, we removed no money from CCPL's budget. We restricted some but left it in the budget. Their budget was not changed that day. I've been meeting with the director of Carroll County Public Library probably 3 or 4 times, starting on October 27, 2023, on some issues I felt were serious with Carroll County Public Library. I've also met with over half of the board. Many of the issues have been addressed and their history. 2 of the ones that have not been addressed, collecting fines for adults and some branches being opened on Sundays, has not been addressed. Carroll County Public Library stopped collecting fines before Maryland law restricted fines from children. Prior to that, they had collected annual fines between $180,000 and $280,000, a significant amount of money. The estimated amount from adults only is $30,000 to $50,000, with a cost less than $9,000. Not only does it make a profit, it teaches responsibility. And my concern, if people do not assume the responsibility and pay that, then that's $30,000 to $50,000 burden on the taxpayers. The commissioners gave Carroll County Public Library money to open on Sunday. They stopped that during COVID, like a lot of things, and decided not to reopen, repurpose the money, but without the commissioners' permission or discussion. All surrounding counties have some branches open on Sunday. Some say Sundays are their busiest days. I only speak as one of 5, but I feel we need to have some branches open on Sunday. I've heard from homeschoolers and others who miss it. On Monday, May 13th at 6:56 a.m., I sent an email that said, "I haven't seen or heard anything on collecting fines or Sunday hours. Unless you are collecting fines from adults and plan to open a couple branches on Sunday, I'm going to propose restricting the one-time money until that happens." I've heard from homeschoolers in the Eldersburg area disappointed the library is not open, and CCPL was given money specific for that. When we started our meeting at 1:30 on May 14th, I had not received a response. I made a motion to restrict that, but keep it in the budget. It passed. At 2:23, I got a response that did not address my questions, but restated an email from April 9th on why things had changed years ago. I didn't read it during the meeting. I don't read emails during the meeting, but that's when I got it. I sent another email on 5/14 at 6:14 p.m. Received a reply the next morning at 7:50 a.m., replied to it at 8:35 a.m. I restated the need to collect fines and be open on Sundays. I have not received a response. I spoke to a board member yesterday and was told they are meeting on Tuesday to address all of this. I voiced my concerns with the board member and said what I feel is important, and that, again, the restriction on the money, if all this is resolved before July 1st, it's not even a restriction. It wouldn't take effect till then anyway. Evidently, some of these emails made it to social media. Without knowledge of all of the discussions and all emails, incomplete information is worse than no information. I'm sorry you believe the lies on social media, but that's the nature of social media. I haven't looked at it. I did get messages from people sharing some of what it said, and I think one site even put on a link to the video because that site said, evidently people have misinformation, please watch the meeting. And like I say, people shared comments with me. I did get on social media to wish some people happy birthday and look at some individual sites, but I haven't seen any of this on there. Which side did we start with last?
I cannot remember.
I think it was Commissioner Rothstein last
I
week.
think so. I think it's
All
your
right.
turn,
Okay,
Commissioner
thank you.
Guerin.
Well, good morning, Carroll County. I will be extremely brief because we have a very busy day. In fact, if you are looking for some entertainment today, I would encourage you to tune in and watch all day long because it's going to be a big one. We've got Board of Health here early this morning. New board has created new expectations, new questions, so we've been working through those. Then we're moving on to the issue of marijuana sales within the county jurisdiction. Is that a good idea or not? We're talking about a road closure that none of us really want to close, but we've got to figure out how to do it because the bridge is about to fall apart. And then, when you think you're just done with everything, we've got budget this afternoon. So it's going to be a really interesting day. I would remind everybody watching that, we have a commissioner form of government here. It is a bit clunky. It can be slow. It can be difficult, and it can be messy. But it is the best form of government for this county, and it works for us. It is a representative form of government. And I would just remind everybody when you're watching that in today's day and age, it's hard to get people to agree on anything. And when you've got 5 people from different parts of the county representing different parts of the county, which is why we're here, I'm District 4, it can be messy, but it might also be entertaining to watch. So today's going to be a long day. I appreciate everybody who's here. I appreciate everybody sticking with us. And again, just remember, we're doing the best each of us feels we can do for our constituents while we're here. And I know I can only speak for myself, but I think I speak for all 5 of us when we say that's exactly what we intend to do. So thank you.
Mr. Gordon.
Good morning. So I'm just going to touch on a couple highlights from the past week. On Friday, myself, Commissioner Kyler, Delegate Tomlinson, and our Director of Economic Development, Denise Beaver, all met with the fine folks at Penguin Random House and toured the location in Hampstead. Chris, do we have photos for that? I guess we don't. I was hoping we did. Great location, incredible property. It's a 1 million square foot warehouse. And, Carroll County has a lot of what I would call hidden gems. Sometimes we don't realize some of the businesses and industry that are here. One of the big uses for the Hampstead location is Marvel Comics. They are the only distributor of Marvel Comics, which is actually quite significant. But they also do book distribution out of the Hampstead location as well. Some people don't realize this, and there was some interesting conversation going back to even during COVID with certain entities being closed and restrictions being placed. But Random House in Carroll County is one of the most significant locations for distribution of books. And it was interesting, I was having a conversation back then with a former colleague, and they were absolutely shocked to know how significant our location here in is Carroll County. So we have incredible businesses in Carroll County. This is just one, and we're very blessed to have had them here for as long as we have, and they obviously have continued to expand. And I thought that was a great opportunity for those of us that got to attend that on Friday last week. On Saturday evening last week, I attended the Carroll County Veterans Independence Project Gala. That gala was notably a very packed house, a lot of individuals, veterans, and other members of our community there. The gala raised over $125,000 to support veterans in Carroll County, which I think is always a worthwhile cause. I know everyone in Carroll County is very supportive of our veteran community, and it was a very nice evening and very, very, very well attended. It was on the 14th, myself, Commissioner Kyler, and Commissioner Rothstein attended the 9th Annual Drug and Overdose Vigil here in Westminster. It's always a very emotional evening. It's one of which, irregardless of it being family, friends, or just people in our community, addiction touches everyone in so many ways. And I've attended that for a number of years, and I think every year there's a different takeaway no matter how many times you attend that event. I really, in some ways, wish we didn't have to have a 9th annual or even a 1st annual event like that, but it's always good to see our community get together and wrap our arms around everyone and support all of us within the community. And also yesterday, I believe it was myself, Commissioner Vigliotti, Commissioner Rothstein, and Commissioner Kyler attended the luncheon we held for our Employee Appreciation Day. It was easily several hundred employees. As always, thank you to all the men and women that work for us. It's always great to see everyone out there. We had inflatable axe throwing. Fortunately, no real axes in the room, but always good to give back and thank all of those that do so much for all of us in Carroll County, and it's something we can never say enough. But again, just want to say thank you to all the employees and all the other agencies that attended and turned out. And I do want to make one other quick point this morning. I want to thank everybody for their emails over the last several weeks. As some of my colleagues have mentioned, we're still kind of cruising through emails. I think I was looking at emails till about 1 o'clock this morning and responding to a lot of them, but I do sincerely appreciate everybody's opinions, regardless of what anyone's opinion is on any topic. yes, we have a representative form of government, and you have a right to let us know how you feel, and I just want to say thank you. And that's all for me today.
Mr. Vigliotti.
Thank you, Commissioner. I will echo the comments both of my friends and colleagues up here have said before me. I have 4 things to go through today. I'll try to be quick. So last weekend, I had the opportunity to attend the Tawnytown Business Breakfast, where the guest speakers included their Chief of Police, Adrian Baker, and Stephen Clark, the Public Affairs Specialist for the Office of Disaster Recovery and Resilience for the U.S. Small Business Administration. What a title. Mr. Clark is in the area to see how the Key Bridge collapse has affected Carroll County, and I made sure to let him know that the collapse is indeed affecting our farmers in major ways through the sale of their crops and their produce. I'm glad that these agencies are investigating the effects of the Key Bridge collapse and taking steps to try to mitigate the issue. This week, along with Commissioners Kyler, his better half, Rhonda, School Board President Marcia Herbert, and Commissioner Rothstein, we had the pleasure of attending the Westminster FFA banquet at the Farm Museum, where members of the FFA conducted business, handed out awards, and at which new officers were sworn in and took their posts. I was grateful to have been invited to that banquet and to be able to demonstrate a small measure of respect and appreciation for the young men and women who are the rising generation of farmers and agricultural workers for our county. The same is also true for being able to attend with my colleagues Employee Appreciation Day. I was grateful to attend that and to get to meet and speak with more of the awesome men and women who serve our county. And among those I got to speak to yesterday was Kathy Joy, who works in technology services, and she reminded me that the County Humane Society is very much in need of donations, especially relating to the more than 30 animals that they took in following a house fire in Tawnytown a couple of weeks ago. So if you're able to help out, whether it's a few dollars or some old blankets, the Humane Society very much needs the help. I will thank Kathy for taking the time to remind me of that and to remind me that the situation is ongoing. Last but not least, I want to make an announcement for the 6th Annual Rubber Duck Derby and Jeep Show and Shine Festival in Union Bridge on June 1st from 11:30 a.m. to 3 o'clock p.m. at the Donald D. Wilson Walking Trail just inside Union Bridge. Among those things that will occur that day, a rubber duck race, a Jeep Show and Shine, which is a vote based on the choice of the attendees, raffles, there's going to be a kids zone, a petting zoo, food trucks, craft vendors, it's going to be family friendly, and there's going to be a free shuttle to the event from parking lots. And also the Union Bridge Firemen's Carnival begins at 5 o'clock p.m., and that will also feature food, raffles, live music, and a silent auction. And that's it for me this morning, Commissioner.
Locations at flood zone.
Right, thank you. Locations at flood zone. I apologize, it's not the carnival, the festival is at flood zone.
That's the key part.
That's
Really
the
good
key
beer.
part.
Okay.
Well, for you to be
Just call it like it is, you know? It's good stuff. We
Real
got some
quickly,
really-
if I may, if anyone's interested in donating to the Humane Society, their list of needs is posted on their website.
Thank you, Roberta.
You interrupted my conversation about beer. So there's lots of good microbrewers. Anyway, yeah, I like flood zone. There's a handful of things. Employee appreciation yesterday was wonderful, and we do it every year. I look like a duck. I hate pictures. Anyway.
Going to the Derby?
Lydia there, no. This young lady is leaving us, left us last night, I think was her last day. Wonderful, working for Management Budget under the leadership of Mr. Zaleski and Heidi Pippin. They just have a wonderful team and really do the work necessary to get our budget packaged for it to be released by May 31st. So really appreciate all that Lydia does. She's a good example of the workforce that we do have, except she is young and strong. There's a lot of older and strong. There are workers here 50 years on down that have been in the workforce. And it's so important for me to recognize these employees and the service they do for our community. It's not about the employees, it's about the ability to serve our needs in the community, and you heard some of that proclamations earlier this morning. It's also important for me to get out and about. Our primary role is to establish the budget, which we are in the final throes of, but it's also to get out and about and see the community and participate, as was shared by a handful of my colleagues that were there, the vigil the power that that vigil provides. The state's attorney's office and Tim Weber and his whole team did a phenomenal job during that vigil, and it's just very powerful. And there's a reason why there's Kleenexes on every chair, because they're used. And it also reminds us, at least for me up here on the dais, we put a significant amount of dollars and resources to stop or minimize, not going to stop, but minimize the impact of drugs we have in Carroll County. And we're talking thousands and thousands of dollars that go to different nonprofits, goes to the state's attorney. We have the drug court here. This, to me, is a priority for resources and funds, you know, just like we talked about the sheriff's department and the fire and EMS. There's only so much money to go around, and the vigil reminds us that one life is bad. You know, the dozens of lives that have been taken from us because of the disease that it provides is just horrific. So that was pretty powerful, and I was glad I had the opportunity to attend. The Public Safety Awards, that was brought up, I think, we went, one of you brought it up Monday? When was that?
Yes, Monday morning.
Monday morning. And really good opportunity to, you know, see the strength of our municipalities, along with our sheriff's department and our county, state's attorney, to keeping us safe, and how they all work together as one team, one fight, to keeping us safe in our community, starting from 911 and, you know, calls that came in, and they were also recognized. I don't want to take away the importance of those others that I mentioned, employee appreciation, the men and women in yellow and orange that are in our DPW, because those white lines or yellow lines don't protect them when they're put in harm's way on the roads. And, you know, we did that a couple of weeks ago. I think Commissioner Kyler and I went to recognize them, but it's all part of keeping us safe. Commissioner Kyler and I attended, and he shared that I read a proclamation from one of my colleagues' classes, Celine, but it was a Partnership for Healthier Carroll. It was their 25th anniversary. And it's a partnership, again, a team effort between the hospital, the hospice, the LifeBridge now, the services we provide, the legislation, and everybody getting together for making Carroll County a healthier place and continued place to live. Okay, I don't look as much of a duck, but that's all right. So that was a pretty, yeah, look at those glasses. I look pretty good, though. Anyway, oh, the last thing I want to share is tomorrow is the Blue Star Memorial Marker dedication and park ribbon cutting at the, Saturday. Thank you. You have to whisper. May 18th, Saturday, 10 o'clock. I think we'll be there. I know I will. I think my colleagues will also
I'll be there as
there. It's at the Westminster Veterans Memorial Park. And see, you're invited. You're all invited to attend this. But for veterans, you know, and I've shared this with others, I'm not real big into flagpoles and memorials in supporting our veterans. I'm more into services that we do provide. The Blue Star nonprofit is very strong across our country, and this is a very nice memorial and a service for veterans to go to, you know, and sit in a beautiful park that we have here up in Westminster and in our community. So I encourage all those available to attend. And I was told it's going to be a beautiful weather by Commissioner Kyler, so, you know, we'll see what happens. Okay, that's about all for now. Thanks.
And also Saturday is Hampstead Day from 8 to 3 for anybody that wants to walk Main Street in Hampstead and see some vendors. Item 1 on the agenda is Board of Health. Do we have to do anything? Is that just an item on the agenda?
Or do we have to
Don't you have
close?
to, yeah.
Make a motion to sit as the Board of Health.
I will make a motion to sit as the Board of Health.
Second.
I have a motion and a second. All those in favor?
Aye.
Opposed? Oh, and Chris, you'll let us know if there's any callers for public comment, and I don't know if you have any public comment for this item or not.
Yeah, I'll let you know if there's any for the, so far, they're all for the public comment time at the end.
You'll be hearing from me, sir. Thank you.
Okay.
Sue, did you have anyone else you wanted to sit up with you?
They're all going to be coming up in
Okay.
unison.
They're gonna
We
take
can
their
all fit
turns.
Up here. Morning, and
Morning.
hello again to most of you. I think I've seen you every day this week at an event. We've prepared some information for you for the Board of Health that was requested, some more topical information of what's going on in the county, and then rounding it out with some explanations of appeal processes. Who's up first? Prevention, Wellness, and Recovery. Come on up. You guys might need another chair.
Thank you.
Thank you.
Thank you very much.
Thank you.
And I didn't introduce myself. I'm Sue Doyle. I'm the county health officer, and here today with me is the Bureau of Prevention, Wellness, and Recovery for this part of the presentation. I have Kathy Baker, who's our LBHA and our director, and Amy Legel, who's our prevention supervisor. You guys want to?
Okay. So, I think one of the questions everybody had was about the new executive order and name changes, and I'm Kathy Baker.
Oh, yes, please. And can you just summarize for people listening and people here? We do this a couple times a year. We talk agenda back and forth, and
Yes.
you enlighten us, and
Well, I try to enlighten people. So we're mandated twice a year to meet as the Board of Health to give an update on the health of the county, the wellness of the county. And then we can meet additionally to create ordinances or to discuss health topics. You know, during COVID, we met weekly. So it's topical to the events that are going on in the county.
thank you.
And this was a request. There's been a number of changes to the overdose prevention efforts at the state level, at the county level. There's been changes with the opioid settlement money that's coming in, which everybody believes the state has, but they only have pieces of it right now, just like the county only has pieces of it right now. It's not that everybody's sitting on $320 million not doing anything with it. There's a process that has to take place, but also some of those settlements have not been finalized yet. So Kathy and her team are here to talk about some of the language changes, which is going to open up. We've been very narrow in our discussion of opioid overdoses, and now we want to talk about overdoses in general. There's been a realization that perhaps there's more alcohol overdoses in the county than any other drug, and that maybe we should be looking at everything that's affecting our community and not just narrowly scoping in on the opioid epidemic.
Thank you.
All right.
Sorry.
We'll start over. I'm Kathy Baker, the Director of the Local Behavioral Health Authority and the Bureau of Prevention, Wellness, and Recovery. So one of the questions was to kind of overview this new executive order that came to be January 1 of '23. And when Governor Moore signed the order, it was a restatement of Governor Hogan's executive order. With that, there was a name change from our opioid intervention team, from OIT to overdose prevention team, OPT, which in the county has always been our senior opioid policy group, which Commissioner Gearin sits with us on. And the OOC, which was the Operational Command Center, changed their name to the Maryland Office of Overdose Response, now MORE, which opened us up to do more work with many other substances. There's an updated mission, which is in front of you. As you know, Special Secretary Emily Keller was here to visit us, and she is the director of the Maryland Office of Overdose Response, and she reports directly to the Secretary, Dr. Herrera Scott, and serves at the pleasure of the governor. The Maryland Overdose Response Advisory Council, which takes place, is seated by the governor, and they do multiple other, like, statewide activities for the overdose response. So, and as there's a link to the executive order, which you all have in front of you. Their main pillars in this change has been prevention, harm reduction, treatment, recovery, and public safety, which has always been what we've looked at every time we try to do a new initiative and those kinds of things for the county.
Education is within prevention?
I'm sorry?
Education.
Yes.
Where does education fit?
It's the prevention.
Okay.
link. Just a overview of Commissioner Emily Keller being in the county with Commissioner Rothstein at present, and I think Roberta was there as well. The other thing that's in your folder is also the community's response to that town hall. It is linked with 3 other counties, so it's a conglomerate of 4 other jurisdictions. But I think as they've seen through that, most of the comments that were made through every regional program that they did were consistent. You know, it's more money, more treatment, you know, those kinds of things. So,
And I believe we had the largest showing, public showing, in the state, so they were impressed that we had 60-plus people in attendance.
That's what she said.
For comment.
I remember a large conversation about that, like you said, the resource, the money.
Yes.
But also, just like Secretary Herrera Scott, we talked a lot about was beds. We
Yes.
don't have enough beds in the community, and it'd be great to figure out how to get there.
we're going to talk about that a little bit.
I appreciate that
With us
because,
across the
okay,
state.
thanks.
These are just some of the expectations, which are also in the executive order. It is to be chaired by a representative from the health department and co-chaired by a representative from the community or the local government agency. It previously, in the executive order under Governor Hogan, was the emergency manager, which was Valerie, sat as the co-chair for that group. OPT remains responsible for allocating block grant funding that comes from the Maryland Overdose Response. Any block grant applications must be discussed with the OPT, which we've changed the name from Senior Opioid, and let me see if I can get this right, to Overdose Prevention Policy Group. Sorry. And as you can see, in order to receive the funds from the counties, where there has to be meetings at least quarterly to be in compliance with the executive order. And we must comply with the Open Meetings Act, and if the jurisdiction wishes to combine their local LDAC, which is on the commissioner's website, our Behavioral Health Advisory Council, we can do that, which we've done previously. We have the meeting separated into 2 parts. We talk about the initiatives that are related to overdose response and those kinds of things, and then the second half is our the local Drug and Alcohol Advisory Council. Talking about data that needs to be presented. The decision from the group, I think, was that the LDAC would stay on the Commissioner's website, and anything related to the new OPT will go to the Health Department's website, which is under construction right now, and it will host the agendas, the minutes, and those kinds of things, so, because of the Open Meeting Act. Let me switch it. These are just some of the members that sit on that group. There's representatives from a lot of other organizations that sit in that group, and any one of you are welcome to attend those meetings if you have time. And the next is a survey the state did, and it's in all jurisdictions, so when you see it, it's very busy. But they assessed all the services that were within each jurisdiction and what's lacking what's partially there, what's not there at all, and what is there. And those surveys were published on their website,
So Kathy's sharing with you is that her team reaches out to probably 10 other participants in the county, whether it's law enforcement, whether it's community-based organizations, to try to gather all of this information. And it's a really busy slide, but we want to show it to you. So it has every county in the state in it. It's very busy. And they put it together like this, and then they work with us from the Maryland Overdose
Maryland Office of Overdose Response.
Office of Overdose Response to work on whatever areas are white still. And then we work with the committee to try to address those areas and prioritize which ones we want to address next, which ones we're not ready to address, and which ones we have gaps and barriers or challenges to address.
Or we're partially doing.
So,
You know, one of the gaps in the community is adolescent services, as we all know. You know, one of the areas on this chart is an adolescent clubhouse. When the money came out for that, there were certain jurisdictions that were allowed to pilot that money, and that's who gets it. Frederick County has an adolescent public community center. So we can send this chart over so you can actually delve into it if you have an interest in that.
I see your face, and we did have an interest and expressed an interest in that funding when it became available, which was like, I want to say 12 years ago.
Yeah.
However, we did not have a community provider that was in a state that they were ready to take that on.
Well, I mean, we have CCYSB, we have the school system, we have the Boys and Girls Club that is continuing to expand.
And at that time, we spoke with everybody, and nobody was in a position that they wanted to make application. I actually wrote the grant and ended up not sending it in, so. We have tried to take advantage of every opportunity for funding that we can. In fact, our fiscal officer just this week, when she received the state funding, identified all of the funding that we don't receive from the state overall, and has reached out to each one of those funding administrations to find out why and what we can do to put ourselves in a position to apply for that funding.
I ask that you use us to leverage any of that funding, because, I mean, well, I won't say because, just use the value and the strength of the board to leverage state funds, especially, I mean, like I said, you know, watching the Boys and Girls Club expand to what they're doing and being, you know, not just a staple of the community, but being on the forefront of the state every year after year, is something. And then the CCYSB and, like I said, all the others, I mean.
And the premise behind
numerous.
combining our Behavioral Health Advisory Council and this new Maryland Office of Overdose Response was that there was value in having everybody at the table and respecting everybody's time. So we didn't want to ask people to come to 2 meetings a month, and that senior overdose prevention team was really adding value, and we were getting the stakeholders at the table that we needed to make those decisions.
You had mentioned that was, what, 12 years ago, you said?
The funding opportunity was probably about 12 years ago.
Yeah, a lot's changed with all those organizations in the past decade plus. So, but yeah, I agree.
Part of it was space with all of them.
And I get that, and I agree with Commissioner Rothstein, if there's anything we can do to assist in that, because obviously all those groups are very beneficial and very helpful in the community for everybody. So if there's anything we could do, I'd be happy to help.
Well, and this administration does put out some block grant funding, and there are county providers that do apply for that funding, and the Boys and Girls Club is one of those. So they do get money from the Moore agency, so.
Okay.
I think one of the other questions was what meeting is what meeting, and how does it relate to this and that? And we have a lot of meetings, guaranteed, but there's a lot of work that gets done in each one of these groups specific to those topics. So, of course, we talk about the Overdose Prevention Policy Group, which is our larger group that meets with Sheriff Deweese or somebody from his office, somebody from the hospital, those kinds of things, that list of people that we identified earlier. Then we have our Opioid Prevention Coalition, which Commissioner Kyler sits with on, and we have a Nicotine Prevention and Cessation Coalition. We are establishing a Suicide Prevention Coalition, and we will have a Cannabis Coalition, and we will have the local overdose fatality review, which already happens. So we review basically a large number of the overdoses, the overdose fatalities that happen in this jurisdiction, to see where interventions could have been made prior to their loss, those kinds of things.
Now, what about alcohol?
Alcohol's always in the conversation. We just don't have a specific group related to that because there's so much funding that comes related to opioids and overdose.
And that is a mandated group. Each county has to have an opioid overdose fatality review board.
I did mention when I had an opportunity to Dr. Herrera Scott that we need to look at our alcoholics and is there funding that can be made available for the state to help look more into that and do a little bit more work. Yes, the hospital's admissions for alcohol abuse are higher than any of our other substances in the jurisdiction. So
this is just
this
when
is
they
Amy.
meet.
This is Amy.
Good morning. Hello again. My name is Amy Lajal. I work for the Carroll County Health Department. I'm the Substance Use Prevention Supervisor. And so just to very quickly frame kind of all of this from a prevention perspective. In prevention, we're always working across the whole lifespan, so from prenatal all the way up to our older adult population. We're also trying to address every domain, so the individual, their family, the schools, the community, and then of course the larger just environment, social media, everything like that. We're also trying to address universal prevention, so which applies to everyone. We want to have specific programs for people who are at a higher than average risk, and then we want to make sure we're also conducting early intervention, programs for people who are already engaging with some sort of problematic or risky behavior. And we're also addressing strategies that impact that individual directly, but also environmental level strategies that can change the environment through which people growing up in this community live and work and play. So just very quickly, to go back to some of the coalitions, the lack of an alcohol coalition really is an issue of dedicated funding. It is present in everything we do. We do a tremendous amount of social media around it. We can review alcohol overdoses in the overdose fatality group, and we have. And in fact, polysubstance use is common, and so we're very commonly and routinely addressing all of these concerns as much as we can. And so just as a couple of examples with the Opioid Prevention Coalition, one of our strategies, as we'll get to in a few minutes, is safe storage and proper disposal of medications, which protects not only young children from being exposed to or getting access to medication, but also our older adult population from an accidental or inadvertent overdose. So the Nicotine Prevention and Cessation Coalition, again, addresses policies and practices that will protect young children and teens from smoking, vaping, things like that, but it also does help our older adults with cessation as they need it. So if we can go to the next slide, talking a little bit about the Opioid Prevention Coalition specifically, as we were asked to do. It does meet on the second Wednesday of every month. Commissioner Kyler does attend. We appreciate that. It's funded through the Opioid Misuse Prevention Program, which comes through the Office of Population Health Improvement through the Maryland Department of Health. And we always use SAMHSA's Strategic Prevention Framework. And what that means is there's a strategic planning process that happens that always starts with a needs assessment so that the strategies we choose are data-driven and are also shown to actually be effective at the problems that we identify in our community. And we've adopted a new strategy that will allow us to basically implement an ongoing needs assessment, ongoing capacity building efforts, making sure that the communities are really attending these coalition meetings. So we're hearing from everyone and we're learning about all the problems that there are so that we can effectively address them.
The time frame from a needs assessment to putting, I guess, action in plan. I mean, are we talking 1 year, 3 years, 6 months? I mean, what?
That's a really good question, and especially with this coalition, it's really a perpetual, ongoing process.
Sure.
So we have 2 surveys out right now that have been running for a year, and one is on our safe storage and proper disposal, and we have a public safety survey running as well. And so we will use not only the existing data sources that we get from our county, the Youth Risk Behavior Survey, BRFIS, all of those, but we can use our own surveys too to sort of gauge where we are. We also survey people at the take-back events, which is really interesting. We find that people are holding on and holding on and holding on to medication, so we can adjust strategies, helping people. What we learn from that is we have to do a better job at making sure people are aware of where their drop boxes are. So that impacts our planning for this coming fiscal year. We'd like to do a mini event at each drop box to sort of draw attention to that for that particular community. So we use as much live current data as we possibly can to adjust the strategies that we use. Does that answer your question, Commissioner?
It does, and it'll then dictate the resources to apply to the action.
Exactly.
So, yeah, as long as you're thinking through it from a mission needs statement or whatever you guys are calling it to, okay, here are the requirements, to here are the resources to apply against the requirements that are coming from the needs statement, that makes perfect sense. I'm just curious, it could be very laborious, very time-consuming, which is also another resource, time. But if there's goals in mind, and these are the ways you're achieving, that's great. I just, am thinking through the process, so.
And that's a really great point. To give you an alternate example where it will be a little more time-consuming, our Cannabis Coalition.
Yeah.
So we're embarking on a number of data collection initiatives to be able to effectively measure consumption, but also health and social impacts, type of use, who's using, demographics, all of that type of stuff. We want to make sure that we're capturing all the data and that we're implementing strategies that are data-driven from a health equity perspective, from a needs perspective. So we're able to focus on the strategies that we know right now from existing data are needed in this community, but concurrently we're able to develop and implement these data collection methods that will really allow for a little bit of a more deeper local dive, which will be great, and we'll keep you informed of all of that.
And I think the coalition meeting, it always takes the 2 hours, and but it's a diverse group, so I think it gets the word spread.
Yeah.
But also, because it's a diverse group, you hear ideas there that are pretty innovative.
That's great, because the worst thing that could happen is groupthink in these type of coalitions. So if you do have diversity with age, with backgrounds, you're not going to typically get that groupthink, and you're going to get those ideas. So that's great.
And we're actually, with the turnover of the fiscal year with our coalitions, we'd actually like to work with the coalitions to engage in a very active strategic planning process. So create a space at the next meetings where people can actually share their ideas and we can collect them. We filter all that through a logic model so that we can make sure that we're identifying the problems correctly and that we're applying solutions that are shown to be impactful and not just something that, well, maybe I think this might work. Is there any sort of research that indicates this can effectively
Just
target
on
the problem?
a side note, a template to use, I serve on the Governor's Workforce Development Board and underneath Labor, and they have a pretty good template of doing the things that you're trying to achieve. It's a different topic, but how they break into groups and build, we build scenarios, and then once we build a scenario, we work towards, okay, here's the resources to achieve that scenario, the time, people, and money. It just may be something afterwards, take a look at.
That would be great. I'm always looking for systems. I'm happy to take a look at it. And we're also going to be engaged in, we're not sure of the size of this yet, this depends on funding, but a community mapping initiative that will allow us to map the resources that are out there right now so that we can leverage them more effectively. So that's really exciting, and we'll certainly keep you informed on that. So for the Opioid Prevention Coalition, this is only a small part of all of the overall overdose prevention efforts, which is what Kathy was talking about. And for the role of the coalition, we're really focusing on safe storage and proper disposal because that is still, in terms of our community, what we see as a need. We're also focused on academic detailing, which is a really cool educational outreach model that lets us engage with physicians to learn from them and also to provide information on best practices. And then if you want to go to the next slide, thank you. So these are just a few things that we've have done, examples of things that we've done. So for public safety training and education, we've worked a lot with creating systems where we can provide effective training on science of addiction, stigma, adverse childhood experiences, positive childhood experiences for our first responders who are interacting with our community members every day. And we also are having a first responder wellness event where we're bringing in a sergeant who's also a clinician from Massachusetts and also someone from a tech corporal who runs a wellness program in Howard County to really give our first responders some very impactful information about the neuroscience and neurobiology of how that repeated trauma and stress impacts them, but also tools to mitigate it, both on the job and at home. So we're hoping that that is really impactful for them. And we're, of course, doing survey distribution, social media posts with all of our campaigns. Safe storage and proper disposal, we just had another take-back event. At our October take-back event, we collected 96 pounds of medication and 132 pounds of sharps. And at the October one, which we partnered with Solid Waste, and of course the Carroll County Sheriff's Office, who's a great partner to us, we collected 144 pounds of medication and over 200 pounds of sharps. So these are very much needed in the community. It was a great day. We were really happy to be able to engage with all the cars that drove through and the people that were there. And then the next question, I think, generally was about how we engage with the public school system. So I'll just briefly touch on some of the things that we do. So we provide guest speaking for Carroll County Public School health classes. We work together with the supervisors at the public school to make sure that what we're providing is what's needed, is what's going to add to and complement and supplement the existing curriculum rather than be overly repetitive. And all of the presentations from a prevention perspective focus on promoting critical protective factors. That's really what's so important. And they're all, again, developed in partnership with the school. And I'll give you an example of a few at the next. So at the middle school level, for sixth graders, we promote and teach and practice drug refusal skills, which essentially is just learning how to set a healthy boundary with a friend or family member that's asking us to do something that we know isn't good for us, we know could maybe get us into a little bit of trouble. It's not a skill we're born with, and it is one that takes practice. It doesn't come easy to even a lot of adults. So we're really pleased to be able to do that. Seventh grade is anger management and healthy coping. Always very interesting doing anger management with seventh graders. They need it just as much as we do. It's great to get in on the ground floor there and teach that healthy decision making. Eighth grade is future-oriented thinking. This is such an important protective factor. Being able to think about and plan and hope for your future, feeling like you have the skills and the resources to take steps to meet those goals, even if the goal is next summer or if it's in your future. And all the presentations are super interactive and engaging. At the high school, we're doing a really interactive research-based science of addiction presentation where we're able to guide students through what is the brain, what happens in the brain when we use drugs, and specifically what happens in the adolescent brain. So we have a great discussion about what are some of the risk factors and what are some protective factors that students get very involved in. We talk about treatment, we talk about relapse and recovery. We also provide them with an opportunity to ask anonymous questions, which has been a really informative segment for both us and the students, and I gave you just some of the examples of the questions they ask. There are students who are never going to ask a question in a class, so we wanted to make sure that they were being heard, and then there are students who are just not going to ask that question in front of their peers. So things like, is substance abuse genetic? How can you help somebody who's using substances? Do dopamine levels fully recover after the person is in recovery? How are we expected to plan our futures when our brains won't be fully developed for another 10 years? It's such a great question. It shows a lot of critical thinking and listening during the presentations. Wrapping it up. Okay.
In working with the schools, I know there was a lot of discussion, I think back in the fall, about flu shots, vaccines, et cetera. Some counties, school nurses are health department employees. Some counties, they're consultants. In this county, they're school employees. So you have some restrictions on giving vaccines. It's not that somebody didn't want to do it. We're just different than other counties. Is that right?
You are correct. And that's what makes it so different and challenging. When the state changed their mind at the last minute and canceled a contract, we had 2 months. We do not have the infrastructure to go to every school to provide those vaccinations. They were done in cooperation with the schools and an outside partner, which we could not contract with at that point because the contract was through the state. So we're looking at opportunities for this year that will be better.
Okay, good.
And Amy, don't rush through this. This is the quality. The quality is the conversation we're having, not, rushing through slides. The middle school, high school agendas, what are we missing? We've been doing it for a while, and we're still finding our kids being addicted to something. Is it recognizing that, it's a disease that we have to deal with and grapple with and stop calling it, just an addiction or just, not sampling or testing or whatever they call it, but it's actually a beginning of a disease that can cause significant problems in the future. At the vigil the other night, that's what we listened to, was that the disease took hold. And maybe, in these classes, them recognizing this is a disease and it's just unfortunate that it's an invisible disease. You cut off your leg, you're going to see somebody with one leg. You have a disease of addiction, and they're still going to be able to tie a tie and wear a jacket or whatever, and you're not going to see that disease affecting them, or, PTSD or some other invisible. These stigmas, maybe that's it, is identifying and doing the hard truth about the stigmas associated with this. Because these kids are smart. I mean, they're high school, and they're working. I mean, I worked in high school, and they're managing their money, and some of them are, or some of them are stealing it from their parents or whatever they may be doing. But I'd be interested to hear and listen and talk with you, maybe not now, but what other things we can do to silence the stigma of this and to recognize that it is a disease that we're having to fight through. Does that make sense?
I think that's such an important point, and it really is why we chose for the high school levels to focus on the science of addiction.
Right.
So we're training students in the science of this. We also do have open conversations about stigma and talk about how this is something that used to be viewed as a moral failing or a matter of willpower. And we talk about how that really isn't consistent with decades of science.
Right.
They just may not have been exposed to it. So we drill down very hard in that, and it's much more effective. We could go in and just do a presentation on fentanyl.
Right.
It's much more effective if we teach them enough of the science so it's applicable to any substance in the brain. Any chemical is going to have an impact on the brain, which is just a complex chemical communication system. Once they sort of click with that, they're much more willing to listen to substance-specific information, and they get the stigma.
Yeah.
I have to tell you, the next frontier, you asked what's missing. So one of the things that we identified, at least on our end, media literacy is a really important part of substance use prevention because of how distorted the messaging can be and how overwhelmingly targeted adolescents can be by media messaging. So we are working with the public schools to develop specifically around tobacco, because there's decades of research behind it, some sort of presentation that helps adolescents deconstruct ads and understand the impact that they have on them. So we're very excited about that.
That's huge. And, taking you over to the installation, seeing the resilience program, it's web-based, promoting that there is available information of value, not social media garbage that some people will throw out there, but of actual value. And this is how you can find, the resources for every parent that's out there dealing with a kid, or the parent themselves, or the child themselves. It's all on here if you know where to go. And I see you're doing some of that. I'm just curious, and again, with this, with the QR code, it is a method. Just thinking, what else?
I think you heard Beth talk the other night at the vigil, and she shared that the first time we were invited into the schools, we were put in the library.
Right.
I was there with her, and we sat there, and we had 7 parents come in, and we've made great strides in getting into the back-to-school nights and making sure that we're at those assemblies, where we're back to the meet the coach night for the parents, so that we can explain these
Okay.
things and we can talk through what's going on. And that's taken years, but part of it is, for a long time, there was the belief that if we talked about this with the kids, it would let them know that if they became addicted, they could come out of it, and that that was a bad thing. And that's really not a bad thing. Educating them and giving them all the information that they need to make informed decisions is a better approach. So giving them the science of how the brain works and what can happen, and that it is hereditary and it is genetic, and, you know, that there are pitfalls you should be looking for before that happens. But it's taken us a long time to build that back up.
So over time, the degree of effectiveness of the change in how you're approaching this, has that yielded results?
If you're talking about evaluation, because these are not evidence-based programs, we don't have an evaluation method in that sense. It's very difficult with the time we have. So most evidence-based prevention programs, which we love, are implemented over a series of weeks. So while we can't do that in 1 hour in a school setting, what we can do is take elements of those programs to make sure that what we're doing, although it isn't technically an evidence-based program, is research-based, is science-based, and generally over time in other settings is found to be effective.
How about in a more, I apologize, what about like in a more general sense, like the response of students in general, not in the program saying, oh, I want to know this or that, but how do they respond in a general way to these kind of efforts?
They respond very well. I wish I would have brought, I have a number of notes from students. Almost every class, a student will write a note, thank you so much for this. I really take the anonymous question segment as an indicator too. They're incredibly engaged with that. They want more. We've provided them with a tremendous amount of neuroscience, and they ask for more. And they ask for how to relate it to their situation or how to relate it to this body of knowledge that they have. So we take that as positive.
Awesome. Thank you.
Of course, and the parenting programs that we do, because we have more time, we do use evidence-based parenting programs like BOTVIN or Guiding Good Choices or Staying Connected with Your Teen. So we also participate with the state's attorney's office in their Don't Believe the Lie assembly program, which we've shifted in conversation with the public schools from 8th grade down to 7th grade, just to provide that reinforcement on drug refusal skills and setting healthy boundaries a little bit earlier. So they're getting this throughout the CCPS curriculum. But what's important about the partnership is that students are then seeing, not only is the school kind of telling me this, the health department and the state's attorney's office and the sheriff's office, all of these other agencies are all in lockstep about this message. So that's really powerful, and that's a protective factor for our community. So the last thing I'll talk about is Sources of Strength, which is an evidence-based suicide and substance use prevention program implemented in all middle and high schools. We're very happy to be able to partner with the schools. We were able to reallocate some of the funding we had for another grant to support the Sources of Strength programs, and we were able to do peer leader retreats. The middle school got snowed out, but the high school one happened. We brought in a neurobiologist to talk to the peer leaders and do a deeper dive into some of the sources of strength. They asked him so many questions that we had to cut them off. It was, I think they would have asked him questions all day. We also brought in a social worker on faculty at McDaniel to introduce some of the wellness pieces. And so these peer leaders through the Sources of Strength program are being asked to do a lot through this program. They're being asked to support their fellow students and promote norms that can be healthy for the entire school. So we wanted to give them a day that supported themselves and allowed them a deeper dive into this. That's all I have.
Wow.
Hi, good morning, Commissioners. Marie Weddick, Deputy Director for the LBHA at the Health Department. One of the things you did ask about were some of our beds, as you talked about, Commissioner Rothstein. So I wanted to just give a brief update or a presentation on the continuum of care. So I don't know if you can see the slides, but it goes all the way from, glasses for this, from .5 early education, all the way up to your level 4, which is your medically managed intensive inpatient services, which is a hospital setting. So along those lines, you've got your outpatient services, your intensive outpatient, and your partial hospitalization programs. You've then got your clinically managed low-intensity residential services. So those are your 3.1s. Those are going to be equivalent to your halfway houses, what used to be termed as halfway houses. It's individuals who can live and work in the community in recovery setting, in where they are in their recovery. Then you've got your 3.3, which is clinically managed, and that is in a residential treatment setting. That is actually with the new ASAM coming out, that level of care will be taken out of the equation. And then is your 3.3, which is clinically managed high-intensity residential services. Again, that is in your residential treatment services. And then also your 3.7, which is like our Shoemaker that we have here in the county. Here in our county, we have 60 local residential beds. Those are housed at the MMS location down on the campus of Springfield Hospital. 6 triage beds where the max capacity that they are able to stay is for 4 days. And then 26 level 3.7 and the 3.7 withdrawal management. And then the remaining beds are used for the 3.1, 3.3, and 3.5 levels of care down at that facility.
And they serve more than just Carroll Countyans.
Correct.
Or regional.
Correct. I can tell you more than, we just did our site visit, actually, and they're definitely at about, they're more than 50% still for Carroll County residents that are being utilized.
Yeah, I understand. I just, but, making the point that it is not just a Carroll County resource.
Correct.
When
Is a
the
regional-
residential, when all of substance use went into the fee-for-service world
Right.
and was no longer grant funded,
Right.
it became a fee-for-service, and you cannot limit the regional, you can do a regional area, but you cannot limit where you take people from unless you're funding it yourself.
Right.
We have to address all of the needs of the area.
And this was part of the conversation I had with, whatever her name was, the special secretary
Yes.
was.
Melissa
Emily
Lord.
Keller.
We need more beds because, 30 residents, it's just not enough. And, I don't know about creating another Mountain Manor or doing another RSS. I don't know what the answer is, but something's gotta happen, so.
Those are in discussion as
Okay.
options,
Okay.
especially with the settlement money from the opioid, that some of that can be used for construction, so we're pursuing what options are
And there's
available.
room down there to expand. So, okay.
I can tell you the triage beds that are, however, for Carroll County residents only, because that is paid through a grant.
Yeah.
Yes. Statewide, there's 1326 statewide beds throughout Maryland for individuals who are in the public behavioral health system. So that includes your Medicaid, Medicare population, and uninsured. Commercial insurance providers are also available in Maryland. Of course, it's not just Medicaid and Medicare. And then we do have open access hours here in our county, which we're very fortunate to have. There's individuals who can walk in and get an assessment same day without an appointment. And so I have listed the schedule here for your information and also anybody in the community who might want to access this.
And this was greatly expanded through the Greater Regional Integrated System Crisis Services through the GBRICS process. We had 2 providers that were doing same-day access, and now we've been able to expand with
So
that
this is all
funding.
part of GBRICS.
Well, this is
A portion.
a portion of
Okay.
GBRICS
Yep.
has helped this expansion.
Okay.
Yes. And that's all I have. So
Contact information for the Bureau and what that person does so that you're getting the right person. All right.
thank you.
Thank you.
Are you, within those offices, Sue, are you fully staffed
For
for these offices that just spoke?
few peer position, I believe they have open right now, a few peer positions. And that's because our peer recovery specialists have been able to take on other roles.
Right.
Because of their education and their training.
Right.
So they've been promoted to different
fleet up.
things. Yes, so, and they're like entry-level positions, and we
Right.
want people to grow, and we want people to get back into
Yeah.
working in the community and doing other things beyond the scope. So We have some entry-level positions, and I believe one, and I'm gonna mess it up, Kathy, state care coordinator position, that we're changing. Instead of 2 positions, we're having a higher level position. The work is something that somebody, that one person can handle. But that's to provide resources to anybody admitted to a residential treatment provider in the state of Maryland. So wherever they're admitted to, they have a contact back here in Carroll County if they're a Carroll County resident, and then we help to link them with the resources and the other needs that they need when they come back into Carroll County. We don't want to lose them. The biggest fear, and the worst thing that can happen is for somebody to leave residential, not get linked with the next level of care or the next resource for them, because there's the greater opportunity for relapse.
Yep.
And then losing all of that you've built.
Yep. Okay.
Okay,
thanks.
joining me now.
Hi, good morning. My name is Lily Rayburn.
Morning.
Good morning. I'm the nursing supervisor for the Communicable Disease Program here at the Health Department. And it's my pleasure today to give you an update on measles and also on avian influenza.
And before Lily starts, I just know that just this morning we received an email. There's a 12 p.m. meeting, a national webinar on the highly pathogenic avian flu. So I'm going to hold, if there's questions about it, I'm going to wait till after that webinar, because we're learning stuff. Things are changing all the time. So I just want to put that out there.
Okay, so we're going to start off with measles. Measles is a viral illness, and it has a typical onset of a high fever, and that fever is usually 101 degrees or greater. It is also accompanied by a cough, a runny nose, conjunctivitis, and it's always followed by a rash. It is highly contagious. It is spread through the air when an infected person coughs, sneezes, or even talks. It is so infectious that if the infected person were in the room with you and there were 10 unprotected people in the room, 9 of those 10 people would come down with measles. So it's that infectious. It's one of the most infectious diseases. Outside of the body, it can also last for up to 2 hours in the air and on surfaces. So, you know, that really impacts the community, because if you've been in the waiting room with someone with measles, you may not even know that you've been exposed. The person is contagious 4 days before the onset of the rash and 4 days after the onset of the rash, so that's a total of 8 days. Your index case is often unvaccinated or under-vaccinated, and typically they've traveled. We're a very global, mobile society, and lots of times this is imported back into the United States. There are a lot of countries, according to the World Health Organization, that still has measles outbreaks, such as India, Pakistan, Japan. Many countries are listed on the World Health Organization. Okay.
So for us, I mean, is this something that's coming back? Is this something that's reoccurring? Is this something that we just want to make sure that we're on guard against?
It's something that has always been. A little bit of history on measles. We began in the United States in 1912 to notify everyone nationally that it was a nationally notifiable disease, and that's because people were dying. There were 6,000 people every year dying in the United States from the measles. There is a global effort from the World Health Organization to impact other countries outside of the United States. They have been somewhat successful, but you can't make people take a vaccine if they don't want to. And sometimes it's a matter of financial resources as well. But I do know that the World Health Organization is working on that. Here in the United States, of course, COVID impacted the immunization schedule. Immunizations kind of dropped during that time. There is a movement with anti-vaxxers right now, and we know the best way to protect yourself is through vaccination. So a couple of things going on that creates this situation. Did that answer your question?
It did. Thank you very much.
Good, good. Okay, so even in healthy children, we know that there are complications from the measles. They often have ear infections, pneumonia, croup, and diarrhea. There are also serious complications. 1 in 5 people will typically become hospitalized during that time. We also know that this impacts pregnant women as well. It can cause stillbirth, miscarriage, low birth weight, and an increased risk of preterm delivery. We also know that 1 out of every 1,000 people will develop brain swelling, which is like an encephalitis. And 1 to 3 people out of 1,000 people will typically end up dying from measles. So people still do die from measles. There is a rare and fatal disease that can occur from measles 7 to 10 years after the person's been infected with measles, and it's called the SSPE. It's there on your slide for you. It is rare, but it can and does happen. Okay, so what is our current status with measles? Between January and May 10th of this year, the CDC has been notified of 132 confirmed cases of measles in 21 jurisdictions, and we've listed those jurisdictions for you in the slide. Out of that number, 81% of those who were infected with measles were unvaccinated or their vaccination status was unknown. 44% were under the age of 5, 23% were ages between 5 and 19, and 33% were older than 20 years old. So clearly you can see that it impacts children significantly. They are very vulnerable.
What's the typical age for a measles vaccine?
Typically, at 12 months old, you would get your first MMR, and at kindergarten, you would get your second MMR. The CDC recommends people that are traveling internationally, particularly young infants before the age of 12 months, that they get vaccinated prior to leaving the country. It is typically recommended that you do that minimally 2 to 3 weeks before you leave the country. We know that we can detect antibodies in the blood from the vaccination within 2 to 3 days, but full coverage and protection is not until about 2 to 3 weeks that we know of.
Thank you.
You're welcome. So this slide, what does measles look like here in Maryland? We do know that in Montgomery County, there was 1 resident who had traveled internationally, which is no surprise. They were had a confirmed case of measles on February the 1st. The patient did not, they were not sure of their vaccine status. They also had a close contact of a 6-month-old infant. The potential exposures that the investigators need to look at was their flight that had returned to Dulles Airport. It also affected the airport terminal and people in the terminal, travel to home, and the emergency department was called in this particular case, so you had EMS people that were exposed, and then you had a whole apartment building full of people. The good news is that they were able to contain that one particular case, and thank goodness we have not had any more cases reported in Maryland since February. So that's really good news for us. We do need to be mindful and be vigilant and not let our guard down, because there are pockets of people in Carroll County that are unvaccinated or under-vaccinated. Okay, next slide. What is our role for the local health department? What do we do about it? We manage, we look at cases, whether there's suspected cases and confirmed cases of measles. We look at those. They are under the care of a primary care provider. We monitor them for symptoms, but our biggest role is looking at their contacts. So a close contact is someone who has shared airspace with someone who has had the measles. We're going to look at that shared airspace. We're also going to look at, where has that patient been that 2 hours when it's possible that you could have gotten it without them even being in the room. So we look at that. We do the contact tracing. We look at day 5 and after the first exposure to day 21 for the last exposure. Measles has an incubation period of 7 to 21 days, typically 10 days being the medium average. So you're not kind of out of the woods. If you've been exposed and the next day you don't have it, you are not out of the woods. You have to look for that 21-day period. We will tell the patients to isolate themselves. If they become symptomatic, they are to notify their healthcare provider. And again, we jump into action with contact tracing. Again, I'd like to reiterate, vaccination is your best protection. We encourage vaccination. We promote vaccination. We do carry that vaccine at the Carroll County Health Department. It is local to Carroll County citizens. Local vaccination rates need to be about 95% to minimize the risk of an outbreak. Your first dose of your vaccination gives you approximately 93% coverage, and your second dose actually boosts that to a 97% effectiveness. So it is a very effective vaccine, and measles is definitely preventable.
This is another area where we touch the schools. So when kids go back to school, they review all the immunization records in coordination with the health department, and then we look at the kids that are not up to date with their vaccination, and they have 20 days to get that taken care of before they're prevented from going to school. So we try to make sure that we provide and have availability to take care of that in that time frame.
Parents do have the right to decide not to vaccinate their children. However, you know, this is one disease that can be very much prevented by simply having the vaccine on board.
So if you do end up coming down with it, I mean, what does treatment look like?
Treatment is comfort measures. There is no antivirals for the measles, so it's all about comfort. If you have a fever, you know, the primary care might provide some Tylenol. You want to hydrate yourself, you want to wash your hands, you want to drink plenty of fluids, get your rest. There is no cure per se for measles. It will run its course. It's a good question.
Thank you.
Other questions? Okay, I'm going to go ahead and move on to the highly pathogenic avian influenza. This is an influenza A. Lots of people like to call it bird flu. What we know about this at the current point in time, it infects the respiratory and GI tract systems of birds. It's shed in their saliva, their mucus, and their feces. And just this past March, we have identified that the bird flu viruses was actually found in cattle. Currently, we have 9 states that are involved with positive herds, and those states are listed for you. State and federal officials are working very hard together to identify any new cases and to kind of keep this contained. Like Sue said, there's a webinar at 12 o'clock today just to give us the update because it is rapidly changing. Okay, next slide. Okay, so for humans, human infections can occur when enough virus gets into a person's eyes, nose, mouth, or when it's inhaled. Human infections are very rare, so that's good news. We had one case that was identified this past March. It was a dairy farm worker in Texas who developed conjunctivitis. That person did not develop any other symptoms, although you can have other symptoms from that. Prior to that, the last case was in 2022 here in the United States, and that was a case in Colorado. And again, I'd like to stress that the overall risk to the public really remains low as we continue to monitor all farm workers who are in contact with livestock or live birds. Farm workers, we advocate for personal protective equipment for their farm workers. Not only that, it's a good reminder for them to wash your hands at all times, especially before you eat. And one important key is to avoid drinking raw milk because that pathogen is found in raw milk. Okay, next slide.
The Office of Preparedness has offered PPE to farmers that are interested, and we can provide that to them. So that's an important piece to make sure that people are aware of. If they're looking for gloves or masks or gowns or anything like that, we can provide it.
Just give us a call. We have the hookup person for you. Okay, so for monitoring and planning, the CDC, of course, continues to monitor this situation. They continue to monitor lab reports, emergency room data. They're always testing for effectiveness of antivirals and vaccines. I think they're preparing for the next epidemic, which we hope never happens, because as you all know, COVID was not pleasant for anyone. The FDA is also testing pasteurized milk. We know that 1 in 5 samples are positive for viral fragments, but not the whole virus has been found. Of course, our goal is to keep milk from sick cows entering our food supply chain. We know that pasteurization kills a whole lot of flu viruses as well as many other pathogens. And in fact, Maryland prohibits the sale of raw milk. That is for human consumption. However, it can be sold for pet milk. So just so that you're aware of that. Recently, the CDC did announce that there was $93 million available to support their efforts for testing, for lab capacity, for surveillance, for data analysis, for gene sequencing, which is totally fascinating that they can actually sequence these genes. They have that money available for vaccine activities and also for wastewater management, because we know a lot of these pathogens are in wastewater. In fact, H5N1 was detected in 9 Texas cities over a 2-month period of time, so it's worth monitoring our wastewater. Other than that, that's what I know to this date and time, and do you have questions about this?
We'll keep monitoring. We'll make you, advise you of anything that we find.
Exactly. And we're available for your assistance at any time. We're available to the public. We assist a lot of physicians, whether it's measles or whether it's the avian flu or whatever communicable disease they have. We're available for consultation. Okay, thank you.
Thank you.
Thank you.
Hello, my name is Ashley DiMaggio. I'm one of the program managers at the Health Department. I oversee the maternal child health program.
Morning.
Good morning. It encompasses our lead initiatives. I'm going to review some of the background on lead exposure and what we are doing, importance of early detection and intervention. The most effective strategy to reduce blood lead levels is to eliminate the lead entirely. There's no other treatment other than to get rid of the source of exposure.
Does the lead work itself out of your system eventually, or does it require?
Mm-hmm, yep, and we case manage everybody, and I'll get to that.
Oh, I'm sorry, didn't mean to jump
No,
ahead.
it's all good. And I'll explain how we kind of do all of that at the health department. So before 2015, the threshold for the elevated blood levels was 10 micrograms per deciliter. Only certain zip codes in Maryland were considered high risk. And in Carroll County, there were only 5, which were New Windsor, Tawnytown, Union Bridge, Manchester, and Sykesville. It obviously did not encompass Westminster, which is a very largely populated zip code. This was based off of what CDC and the Maryland Department of Health criteria had set. And they also, before 2015, they only tested once, and it may or may not have been around 12 to 24 months. Then in 2015, they changed it where the threshold was lowered to 5 micrograms per deciliter, and now all zip codes in Maryland were considered high risk, and screening was required, is still required every 12 months and 24 months at well child visits. Then this past January, they lowered the threshold even lower down to 3.5, which we were worried that it might increase our lead cases, but you'll see down the line as I go through that, that it actually has not that much. So in the United States, lead paint was banned in 1978. However, lead paint doesn't always come from visible lead or visible chips. It can also come from deteriorating paint that produces invisible lead dust. And the dust settles on the ground, and then when the babies crawl around on the ground, they get lead dust all over their hands, and as we know, babies always put their hands in their mouth. Also, toys lying on the ground, that sort of thing, always go in their mouths. Consider what happens in the summertime when doors and windowsills create friction as they open and close, they swell. This can generate lead dust, as posing a hidden risk. Additionally, an interesting concerning fact about lead chips is that they actually have a sweet taste. So this can attract children and make it difficult to prevent them from ingesting the harmful particles. Lead exposure isn't limited to paint. It can also be from imported toys, jewelry, such as, the cheap gumball machine toys that you get, inexpensive online purchases, the contents of the party favor bags that all the little kids get at their birthday parties that they go to. Furthermore, there are certain imported spices, particularly from India and Vietnam, that have been found to contain lead. Apparently, they put them in there because it increases the weight of the spices and it makes it less spice that they actually have to oversee.
Is that kind of like some years ago, there were some companies in this country that were putting shredded wood into Parmesan cheese containers to
Oh my
Is it-
goodness, it sounds like it's the same reasoning. That's, yeah.
less product and more filler.
Yep, yeah. Even imported canned foods can impose a risk because they use lead to solder the lids on. And then if you have, acidic foods like tomatoes and things like that, it makes it leach even more into the food.
So they're still doing lead soldering in some places.
And overseas. And actually, I found out from the case manager that does this, that we actually still make lead paint in the United States, and then we export it. So I
That's
thought that was an
interesting.
interesting fact as well.
I think it's, again, the soldering thing is kind of interesting to me too,
Yeah.
because all the, especially naval travel back in, maritime travel back 150, 200 years ago, they were soldering all of their cans. And more than one expedition had issues because of that. It's just kind of interesting to me.
Yeah, it is. I find it very interesting. So certain occupations and hobbies can also increase a risk for lead exposure. Construction workers, for example, they can bring lead dust home on their boots, and if they don't take them off, when they enter the home, they can track it all over the house. And again, as I said, babies crawl on the floor, they put their hands all over everything, and then put their hands in their mouth. Similarly, children can also be exposed by hugging a family member who has lead dust on their clothing. Diesel engines have tons of lead in them. Auto mechanics, house painters, antique dealers, people who finish furniture for a living. Hobbies such as making or using the fishing weights also have lead in them. And stained glass can also be a hobby that exposes children to lead. So as you can see from this graph, our epidemiologist created the graph for our needs assessment, and it illustrates in 2013, Carroll County was actually higher percentage-wise for lead cases compared to the state of Maryland. Then I said 2013, 2015, the numbers dipped below the average, and then in 2017, everything kind of evened out. Unfortunately, the Maryland Department of Environment, who does the reports, does not have finalized data beyond 2020, so we don't have any recent data for comparison. In 2022, each county was asked to start tracking its own data on the number of lead cases, a task that was previously managed by the Maryland Department of Environment. As shown here, the number of children testing positive for elevated lead levels has been steadily increasing. From January 2023 to present, we've only recorded 2 new cases where children were new to country, which would indicate that their exposure was likely occurred at their home country. This year alone, we already have 11 documented cases, only one of which was falling between the 3.5 and the 5. So as I said earlier, we were worried that it would be an increase, but we're seeing a lot of really high cases. And the highest one we saw recently was 36 micrograms per deciliter. And it's also important to highlight that most new cases are coming from owner-occupied rental property instead of rental properties, which I'll get into why that's important. When a child is found to have elevated blood levels, the nurse conducts an assessment. Well, first I get the result from the Maryland Department of Environment, and then the nurse, our case manager for maternal child health, will call the pediatrician and make sure they've made the family aware. And then they will also make sure that they know the protocols, which are that they need to have a venous blood draw every 2 to 3 months until they have 2 consecutive tests below 3.5. Then they call the family, and they'll do a complete assessment and educate. This is where they would work on trying to figure out where the sources of lead are. And almost all of our cases are from homes that were built before 1978. So the Mount Washington Pediatric Outpatient Clinic has a specialized lead program for children whose levels are 15 or higher. And then during each visit, the family meets with a social worker, a developmental pediatrician, and a nutritionist. And then when they drop below 15, they're handed back over to us, and we monitor them until they're back down to the 3.5. Additionally, families that qualify for Medicaid that are in owner-occupied homes have a program with the Maryland Department of Health and the Department of Housing and Community Development that will fund renovations, for example, new windows, trim. They've even there was an old porch in a house where there was a lot of chipping paint and that sort of thing. They redid the porch for the family. On average, we have about 30 open cases, which includes obviously the new cases that come in and then the ones that we're continuing to monitor until we discharge. So parents are more willing to have their children tested in the pediatrician office with a simple finger stick. It increases participation. Obviously, it's less traumatic than getting a blood draw. It's more of like a glucometer finger stick for checking your blood sugars. To capitalize on this, we used our grant money that we got from the state, and we reached out to the local pediatrician offices and family practices to gauge their interest on using the LeadCare 2 system, which is what can be used in the doctor's offices. And thanks to our grant funding, we were able to assist providers to purchase additional test kits, because obviously you have to buy new cartridges and everything like that. So they already have the machines, they just need to replenish their cartridges. So we were able to buy 5 new, provide 5 new for providers. And even some of them were, ordering 2 or 3 boxes, and each box I think costs like $800 or something. They're pretty expensive. We were also, last fiscal year, we were able to get one pediatrician on board to get a whole kit and caboodle with the LeadCare 2 and the cartridges, and then we were able to get 2 more this past with the extra funding that we got from the state. So it's a total of 3 now. So almost every pediatrician office now in Carroll County has the LeadCare 2 machine, so they can do it in office. Most of the ones that are not doing it are their family practices, and they just have a lot of older children who are not in that 12 to 24 month range, and obviously the kits would expire before they could even use them, so it doesn't really make sense for them. They don't have sufficient volume.
I think we have investigated whether or not we could purchase a machine to put on the Health on Wheels vehicle, so that as we're going out to different events, if parents were not able to get their children tested, that we could do that for them. I know that was, at one point we were talking about.
Yes. And so I'm not sure if anybody saw on 140 and throughout on the west and east side of town, we had 4 billboards that went up that were talking about lead. They were linked to our new website that we have. We were able to create new rack cards that are in English and Spanish that we can hand out to providers, and also, at our community events and things like that. Are there any questions? Okay, thank you so much.
Thank you.
Thank you.
Coming down the home stretch. I'm inviting people. I'm inviting friends.
Hi, my name is Richard Brace. I'm the Water Quality Supervisor with
Morning.
the with the Bureau of Environmental Health. Filling in for Lisa Staley today. Her son is actually graduating from VMI and commissioning in the National Guard, I believe. Yeah.
Please extend congratulations.
Yep. So if there's questions, hard questions, I might refer them to her. So we're just very briefly going to talk about the Environmental Health Notice of Appeal. Back in 2022, each local health department was to include in their website the appeal process. The uniform language is developed for the food inspection form by MDH to alert the customers they have a right to appeal. And at the bottom of the slide is their link to our website with that appeal process, both for MDH and the Maryland Department of Environment. So there's 4 food service facility decisions that can be appealed to local health departments: a denial of application for a license, a suspension or revocation of a food service facility license, an order of abatement, or a summary suspension. And these are all codified in these different COMARs, state government and health general subsections. And then the notice of appeal rights. A copy of the appeal rights are given whenever a notice is issued to the food facility for the following: a denial of their food license, suspension or revocation of their food license, a summary suspension of their food license, an order of abatement. Again, the website's listed below. And then here's a copy of our food service monitoring observation report. That is done at every food service facility. That's where we record the temperatures and observations. And at the bottom it says, if you have questions or concerns about this inspection report, you may contact the local health department by calling this number or emailing our environmental health email.
And that's the consistent language.
And that's the consistent-
language on the website, and then consistent language that's on the form that was mandated by the Maryland Department of Health.
We try to make sure that we're consistent with other counties, so that if you have a food service facility in Frederick, you have the same understanding of your rights as when you're in Carroll County. Now, the decisions that can be appealed to the Maryland Department of Environment. So the appeal rights for the following final decisions regarding a sewage disposal where public sewage systems are not available. That's in Comar. And then water supply and sewage systems in subdivisions. That's also in Comar. And well construction. And then finally, the water supply, sewage disposal, and solid waste as part of shared facilities. Those are the decisions that can appeal to the Maryland Department of Environment. And
So it's important to note that much of the work that's done by the Environmental Health Bureau is done by delegation of agreement through the Maryland Department of Environment or the Maryland Department of Health. So we are in many instances not the end-all be-all, and our decision is not final. We have to collaborate, partner, or get approval from those other agencies. Written into those agreements, the language basically states they have the right of last say on any decision that we make at the local level. So if we're within the scope of what our delegated agreement states with them, we can make decisions based on what is in Comar or what is in policy. We cannot arbitrarily just make a decision that's outside of that without consulting them. If we do, we risk them coming back and saying, you can't do that. And we don't want to ever do that to a business in Carroll County or a homeowner in Carroll County. We want to make sure that we're in step with them and then helping to negotiate what has to happen to make those allowances. Many of the issues we run into are smaller lots of land where the septic needs to be replaced and we can't meet the distance variables for the property next door or from another item that's in there. And I can give an example. I think there was a gas station out here on 140 that started construction, and when we went to do the inspection, we realized that they had not placed the well on the drawing that they had given us, and when we got there, we realized that the well was too close to where they were putting the new tanks, and we had to have the Department of Environment come out, and I believe in that case, the attorneys for the people who were the gas station were able to talk through a new process that they had seen and that was available, and we were able to work through that with the Maryland Department of Environment. I did also, I think that was the end of this, I also made sure that you had the copies from our website of what the appeal process is for a food service facility and what the appeal process is for MDE for on-site sewage disposal and wells on shared, and shared facility decisions. So just so that you have all of that, it's on our website, but I didn't want you to have to go looking for it. And we didn't, originally we had the whole statute in here and we were gonna go through it. And we decided just to pare it down to, these are the things you can appeal for food and this is what you can appeal for well and septic. And to reference the sheets that are on our website, which is, we're available for, we've had installers come, we've had homeowners come for consultation. We're available prior to wanting to start a new business. You can stop by and say, I want to do this, and we'll sit down with you and we'll look at your property. We'll look at what you want to do and we'll walk you through that process. I sit on an agritourism work group that's been started with the state, with the Department of Environment, the Department of Health, and the Department of Agriculture. It has health officers, it has the attorneys for the wineries and breweries, it has the Maryland Association of Counties. I believe there's, I'm gonna get it wrong, it's Grow and Fortify, but they changed their name to Cultivate and Cure. something like that, Cultivate and Craft maybe. And we are all sitting together looking at ag tourism and what needs to be done. There's been some suggestions. We've gone full circle 3 times on whether or not there needs to be regulations that define it better, or whether there needs to be a separate process for those businesses so that they are, because the rules and the regulations were not set forth for those types of organizations. There is a specific class, but there's not generalized rules. So there has been a suggestion of putting together a permitting process that allows for 3 to 4 years for a company to come in to compliance with things, and they would know what they had to work through, and be given that time frame. I don't know what will happen with that until this work group finally makes some recommendations.
So a couple of quick questions, if I might. I know you mentioned that if somebody's interested in like starting a business or something, they can come in, they can ask questions about what has to be done. What is the level of coordination that you have with like economic development and making sure that somebody who decides, hey, I want to start a dairy farm or something, they know that they need to come talk to you?
That was where I was going with this ag tourism work group. The Department of Environment has started working and doing workshops and informational sessions with economic development to make sure that that's standardized throughout the state, that we're giving the same information in each county, and that there's standardization on what we know at the local health department, what the local county government zoning rules are, and then what economic and development should be doing or could be doing to help, so that there's not this diversity of, well, if you go here, you get this information. If you go to this county, you get this information. So that, I do know that that began, and there has been one training so far, and
Awesome.
for all of economic development, because we feel like there's probably some coordination of multiple pieces that could be taking place that hasn't been.
Thank you. I have 2 more quick questions. The second one, when someone files an appeal, what is the, I guess, the amount of time that typically takes, or that you want it to be able to take? I mean, what's the timeline?
There's specific timeframes, so there's, go ahead.
Liz Cianci, I'm starting to get to know some of you. I'm the relatively still new Deputy Health Officer for Operations of the Health Department. So first point of clarification, when the appeal comes in, the appeal request does come to the Health Department. We do not actually hear the appeal. The appeal goes to the Office of Administrative Hearings. So when we get the request for appeal, we send that request with the documentation that's being appealed to the Office of Administrative Hearings, and there are specific timeframes depending on what type of appeal it is that the Office of Administrative Hearings, OAH, has to respond. I've dealt with one so far since I've been here, and I sent the information in within 2 to 3 days. OAH came back with a hearing date on the books. That's all they do. So the turnaround time is relatively quickly, and so what OAH does is once we send that in, they do all of the work. So they notify the company business person making the appeal, they get it on the books.
Bless you.
They send them all the information about if they have an attorney, who the attorney needs to talk to, if they're unrepresented, and that sort of stuff. The times vary, but it's usually pretty quick. The last one we had, the hearing had been scheduled within 30 days. So it is a pretty quick turnaround time, and if there's an expedited need or something that's urgent, the appellant can notify OAH of that and ask that to be moved. And once that request is sent in, only the person who requested the appeal can make any changes. So they're the ones that have to cancel it if something changes, if they change their mind, or something new comes up. They're the only ones that can make that change. The health department, MDE, MDA, none of those, we can't cancel the appeal, or the hearing. The appellant has to do that.
Thank you
I
very
guess
much.
The other piece to note, and that's why I specifically gave you the appeal rights, is that they do differ by timeframes. If it is food related, they have 10 days to appeal the decision, and that's really because it's more, if there's something we don't want, anybody to get food poisoning or anything like that, so they have 10 days to appeal that decision that we make, because most of the time it's because of a high level issue. For well and septic, there's 30 days. Give people more time. Also, when they contact us, if they contact us, we do try to work with them. I've had many a phone call with many a person saying, this is what I was told, I don't agree with it, why can't I have my certificate of water potability, and there's very specific regulations that say you have a test for your water, and then 30 days within the next 6 months, you have to have another one. If it goes beyond that time frame, you have to start all over again. We can't issue the certificate. So a lot of times we're able to work that out at the local level and get people to understand and point out, even though it's been pointing out to them before they take it to somebody higher, they get a different person telling them the same thing, showing it to them in writing, where it is in statute, where it is in law, and we're able to work those things out. So if there's somebody with a well or septic issue that might come back to the health department, we might say, bring your drawing back in, we'll show you what you need to do. There's been a lot of changes over the last, I'd say 5 years with well and septic. There was a period of time where we were allowed to do the designing. There was a period of time where we're not allowed to do the designing. So now it's mostly the installers who take a piece of paper and put it on the front of the trunk of their car and draw a picture of what's going to be happening, unless it's an innovative system, in which case they have to have a designer come in and say, because of the soils in your area or because of some other reason, you have to have either a drip system or you have to have a best available technology system, and that requires all kinds of other things. The Maryland Department of Environment has all of that information on who are licensed and certified installers, who are licensed and certified distributors for those materials, and they can be contacted or we can be contacted to help people through that process.
Well, thank you very much. And my last question has to do with more of a specific case. I was contacted, as some of you know, I was contacted by a citizen who also happens to be a farmer. And this gentleman, through several months of the year, does like a barbecue kind of thing on the weekends at his farm. And traditionally, I know that the health department was very kind in allowing him to file for one permit for the entire season. Very grateful for that. And I know that state law has recently changed to where this gentleman, every weekend that he wants to operate now, he has to file a separate permit and a separate fee. And to my understanding, based on a recent email, was that about 25 of our citizens are affected by this. So my question for you, I guess, is in two parts. First of all, do you find that this is an efficient way of going about these kinds of pop-up barbecue places on weekends for farms? And the second question is, if we want to change that law, is that something that you would be amenable to supporting?
I'm going to refer you right back to this agritourism work group I'm working on, because what we've learned through this work group is that the definition of a special event, a temporary event, or a seasonal event is different for MDE, it's different for MDH, and it's different for MDA. So what we're trying to do is figure out how we can make those definitions more congruent so that they agree with each other, because in that instance, whether we did a seasonal agreement, which is 90 days, which would limit him from the 7 months he actually operates, he could only operate for 3 months, or whether we did, I think it's a special event was only 30 days and you could only get 2, which is only 60 days it covers. And there's no cost savings in that even if we were to couple them together, which the law clearly states we can at this point, I would advocate for those definitions to become more congruent, and I would support that, because it's very difficult for us. For us to tell somebody, oh, you can do that, and then we say, oh, but you can only do it for this period of time, because that's the type of license. We do usually warn people when they're having special events that 499 is the magic number. When you go beyond 500, you need to have a bond. And there are many, many other requirements that come with that. So we do have lots of special events that are over that number. But, that is the magic number if you're having something, is to make sure that you're staying under that. So there's a lot of little idiosyncrasies that we have to work through with people, and we try to do that. And we try to tell them what they can do within this scope, or what they have to do within that scope. Or if they want to, if what they want to do is the full thing, then we walk them through all of those things. And people get very confused, because I did it last year and this is how I did it, but now this year they've added a little twist to it, or they've added a vendor to it, and that adds a different component.
Gotcha. Well, once obviously we get through budget and everything else, I would very much be interested in working on that with you to try to create that sense of clarity for our citizens.
Absolutely.
Happy to. Thank you.
Thank you.
Yeah, absolutely.
Thank you.
Yeah, thank you for the correspondence, much appreciated.
Thank you for your information. I really do appreciate that.
Yeah, my pleasure.
I appreciate you adding the environmental health piece towards the end, and maybe in relation to what Commissioner Bigliotti just said, we could have you back sometime this summer to discuss that appeal process some more. In addition to the notification process, I mean, I think it's obvious we have a couple of use cases we can use to kind of guide each of us to the things we're looking for and our concerns. I know you're well aware of them, so we'll have to work on that and have you back at a later date. Thank you.
Sounds good. Thank you. Thank you, gentlemen.
Thank you.
Thank you. And you did tell us we can talk and meet anytime. We don't need a formal
Absolutely.
meeting, but
I've been over to see several of you.
yes,
Yes.
I think we have to close this meeting.
Yes. Well, you don't.
Motion to adjourn as the Board of Health and go back into open session as Board of Commissioners.
Second.
I have a motion, a second. All those in favor?
Aye.
Opposed? Thank you. Okay, item 2, 2024 Spring Amendment to Water and Sewer Master Plan.
Good morning to both of you.
Good morning.
Morning.
I'm here with Bryce Wagner to facilitate the public hearing for the 2024 Spring Amendment to the Water and Sewer Master Plan. The public hearing was advertised in the Carroll County Times on May 2nd and May 9th. And Bryce was here a few weeks ago to give you the high level. He's going to run through just a couple of slides to refresh everybody's memory, and then we'll proceed from there.
Thank you, Daphne. Good morning.
Morning.
And also to say, the public hearing is also on the county's website, under the public hearing section of the county's website. So as Daphne said, these will be a couple quick slides. So why are we doing the amendment for the water and sewer? The biggest thing is to keep the plan as current as possible during the roughly 2.5 years between the triennial updates of the full-blown plan. So the plans are eligible for updates or amendments twice a year, in the spring and in the fall. And then, of course, once these amendments are done, they automatically, when we do the triennial, they roll into the new triennial. For any project to be permitted by Maryland Department of the Environment, it must be listed in the Water and Sewer Master Plan. That's whether it's a development project or if it's a project for providers to do any kind of work on their system themselves. It needs to be shown in there for the state to permit it. So where are we now? This is the public hearing phase, sort of almost the last step of the process. The next step would be for adoption of it by this board, and then I would forward that to the Maryland Department of the Environment for their final approval. And the plan, the amendments do not become effective until MDE gives their final approval. And just as a quick reminder, so the water service area amendments were for the town of Mount Airy, the city of Westminster, and Freedom. And the sewer service area amendments were for the city of Westminster, the town of Hampstead, and for Freedom. So that's really a quick synopsis of what the amendments are. And if you have any questions, I'll be happy to hear. Obviously, this is a public hearing, so if there's any, we'll follow that lead.
So I guess this is the time for the public hearing. Unless there are any questions?
I have none. Any commissioners, any questions? And Roberta went out, I don't know. Are there any callers for this public hearing?
I have no one on the line, sir.
And I guess we need to verify.
Well, we
Well,
don't,
I
I
mean,
mean,
people here in the
the
room.
choice is either keeping the record open for 10 days, then go from there,
Do we
or,
have any public comment
Verify.
for the public hearing, item 2?
No.
No, okay.
Yeah.
So, yes. Yeah, now we have the option of keeping the record open for 10 more days or going ahead and move forward to MDE for final approval. So, does anybody?
Did we receive any comments at all on this from email, calls?
The only one comment we received was actually a clarification from the city of Westminster that the properties that are looking to come into the water and sewer service area we'll begin the process of annexation in June. So they wanted that to be in the record, so.
So if we
that's-
leave the record open for 10 days, it's not going to inhibit the...
Not at all.
So I'll make a motion to close the public hearing and keep the record open for a period of 10 days.
Second.
Any more discussion?
As opposed to just sending it right to MDE now.
Well, I mean, somebody else might come along and say, I've got
Okay.
water concerns, I don't know.
Okay.
Yeah, yeah. And I'd be fine moving forward also. I
Yeah.
don't know how
I
everybody
mean, I
else feels.
don't have a concern either way, so whichever.
Well,
Yeah.
Although I did second it, so yes.
Well, then I'll make if we're really not too concerned about it, then I'll make an amendment to my original motion to simply approve the 2024 Spring Amendment Water and Sewer Master Plan and forward that to MDE for final approval.
Second.
why not keep it, no, I'm kidding.
Okay, any further discussion? All those in favor?
Aye.
Opposed? Thank you.
Thank you.
Thank you.
Thank you.
It's because of the expertise that briefed us. That's why I feel so comfortable.
Item 3, ordinance change for adult use cannabis. And the public record is closed on this?
Yeah. Yes.
Good morning, Commissioners.
Morning.
So, as you mentioned, we're here for a proposed ordinance change to the zoning code to allow for cannabis as directed by the state. There are 3 specific actions or areas that we're addressing. They are to replace the definitions of medical cannabis, because currently the county code is out of sync with the way the state has amended codes. So medical cannabis it's still addressed in the state legislation, but they now have added adult use to that. So we want to clarify the county definitions so that everything is clear, and that as far as regulating it and so on, the code is clear. The second item we want to address are the setbacks. So the state has gone through some minor changes to the setbacks, allowed some things that the county can adjust. We have taken the stance and recommend using the largest setbacks allowable by the state law. And so that's what we have proposed. And then the third item is to address our use tables. So where dispensaries and growing can occur, to put it in line with what the state has required. So those are the 3 things that we're looking to address with the code changes. And so I'm going to turn it over to Hannah to walk through the specifics.
So, before that,
Yes.
so the intention of what you guys have done is to bring us in compliance with the state changes.
Correct.
Per the state, we're not allowed to be more strict. We could be more lenient, but you've developed a system that we're maximizing what they allow us to do.
That is correct.
Okay.
Okay. With that, I'm going to give an overview of the proposed amendments. Starting out with some background, as we all know, starting July 1, 2023, Maryland began permitting the selling, growing, and processing of adult use cannabis. In this legislation, they gave jurisdictions the zoning authority over adult use dispensaries, growing and processing facilities, and on-site consumption establishments. And then in the 2024 state legislation, they laid out regulations and distance requirements that, as we said, local jurisdictions cannot exceed. So specifically, this 2024 state legislation states that dispensaries must be regulated the same as a liquor store, and that the growing of cannabis must be regulated the same as growing hemp. So specifically in the county, liquor stores are regulated as a general retail use, and we do not regulate growing hemp in the county as we see it as an agricultural use. So getting into the proposed amendments, there are some differences from the language that was sent to public hearing due to the 2024 legislation that was passed since then. So the modification of the agricultural and agricultural purposes definition, removing the language that agricultural or agricultural purposes does not include the growing, cultivation, processing, or dispensing of marijuana. Removing this is necessary due to the provision that we must regulate the growing of cannabis the same as the growing of hemp. And then adding definitions for cannabis products, cannabis dispensaries, cannabis grower, cannabis processor, and then removing definitions related to medical cannabis dispensary, medical cannabis grower, and medical cannabis processor, and then adding definitions for Maryland Cannabis Administration and for on-site consumption establishments. Going on to the next section of our zoning code, chapter 158059, this is the cannabis-specific regulations. So uses related to the growing, processing, or dispensing of cannabis shall comply with the following requirements. First, we have to remove A, that you see strucken out. The outdoor growing of medical cannabis is prohibited in all districts. This is required to be removed, again, due to the provision that we must regulate the growing of cannabis the same as the growing of hemp. And then, as Chris alluded to, the 2024 legislation gave us distance requirements to establish. So that is what we are seeing here. For the purpose of this section, distance will be taken from the nearest point of the structure occupied by the use requiring separation to the nearest point of the structure from which the separation is to be established. So a cannabis dispensary may not locate within 500 feet of a pre-existing primary or secondary school, a licensed child care center, a registered family child care home. They also must be 500 feet from a pre-existing playground, rec center, library, public park, and a place of worship.
And I apologize. I just want to be clear in my mind. The point, so it's a facility, a building. Where the building is, 500 feet to the property line or to the
To the
building?
building.
Building
So-
to building.
Building to building, and building, okay. Not the property line.
Correct. The way we interpreted this state legislation is that they're establishing distance requirements from uses.
Yeah.
So not property lines.
Okay, okay.
And then,
I'm sorry, one other quick question if I might. So on, let's see, what is that? Part 2, it talks about pre-existing playgrounds, rec centers, et cetera, et cetera. I was just curious, I know there was talk with the state legislature to look not only at educational and childcare, but also any other after-school children's activities. Is that within where we're looking at recreation center? So if you had, say, an after-school club, is that included under that, or how is that? I don't know how that language was written on the state front, but I know there was to
I
be
feel like
inclusion
that
of
might fall under the licensed child care center.
See, that's tricky because there's entities in our county that are not licensed child care centers.
Okay.
So for example, really easy one, Boys and Girls Club is not a child care center. So that doesn't mesh well with that. I'm just wanted to clarify that. I don't know if you all could maybe go back and take a look just to see.
Yeah, this was taken straight from the
Okay.
state legislation.
Okay.
Copied and pasted.
And, no, I understand. It's just, because I agree. I want to be very clear, because also playgrounds, it's not where the rubber and the slides are, but it's also the grass where kids are playing, kickball or whatever else they may be on the property. That could be considered a playground, the field itself, the open field. So having that appropriate distance. Then the other part is, it's also as the crow flies. So it's not necessarily a road or a path or not, it could be through the trees, and if it's, doesn't meet that requirement, then they're not authorized to build. And that's also needs to be understood. It's not, on a road distance, it's as the crow flies, and it could be, like I said, because I know of a situation, not in this county, that they could not build because as the crow flies, it was too close to a child care center, even though you couldn't really get to the child care center that way, but that's the rules.
So
okay.
as Hannah said, the language that we're proposing here is directly out of the state requirements verbatim.
Right.
So if this were passed and we had an applicant, this would go to our zoning administrator to interpret. And there are obviously appeals and so on and so forth if someone does not feel that the interpretation is correct and so on and so forth. So as with everything, we strive for exact clarity, but in this case, we've got what the state has given us, and we're not permitted to go above and beyond what the state has provided us.
I take the point about whether or not we can exceed state law in terms of certain things, but for example, as Commissioner Gordon pointed out, and Commissioner Rothstein had spoken to, and I had mentioned previously about law enforcement facilities, or say public safety facilities in general, state's attorney included the fire and EMS as well. Are these things that we can add, or does that by necessity create a more stringent set of circumstances than the state would otherwise permit us to restrict marijuana dispensaries?
So the guidance that the state has given us is that we have to treat them the same as liquor stores, essentially. And so if we do not restrict liquor stores that way, we cannot restrict cannabis dispensaries that way.
So the law, the changes in the law take effect, what, July?
So the original law took effect last July of 2023,
right,
and then these current versions that were passed in this year's legislature, they take effect July 1? June 1.
June.
Yes.
And we do not regulate liquor stores, liquor.
Correct.
Is there enough time to do something about that?
No. That's the short answer. So, and I'll defer to Mr. Burke on process and what's been advertised and so on, but if the board were interested in looking into regulating liquor stores in order to be able to regulate cannabis dispensaries, that would be that would deviate from basically what's been discussed. And so it would have to go back through the process, which, as you know, go to planning commission and so on and I would caution on, there are many liquor stores throughout the county, and so the impacts of that could be substantial, creating non-conforming uses and so on.
So, I guess, and maybe, and help me here, because, so the state law tells us, for example, that we can't restrict a dispensary any more than we do the liquor store, right? But at the same time, the state law is also telling us that we have certain, distances that these facilities have to be, certain distances that have to be between these facilities, right? The 500 feet, the 100 feet, depending on there were proposals for, I think, 1,000 and 2,000 feet, and I'm guessing those did not go through.
So they did, so,
They did.
but it was modified, and that's the distance between dispensaries. So the original, and I believe that was what was in last year's, was that it had to be 1,000 feet. That was amended to be half a mile, and we have added that in.
Okay.
And actually, that's an option for the county to enforce. So the state requirement is 1,000 feet, but the county is allowed to increase that up to half a mile.
And that is in here?
Yes, and we've made that recommendation.
Between dispensaries.
Between dispensaries, yes.
And so if I was to push, for example, going back to my point earlier, or to push Commissioner Gordon's point for elaborating maybe on what we mean by, I don't know, licensed child care center or something, if we were to elaborate on those things, say this is what it means in terms of our definition, is that something we could do? For example, if we said a child care facility is also
Right.
Boys and Girls Club kind of thing.
Sure.
Wouldn't that be the administrator?
I think that's the zoning administrator that would make that interpretation of the requirement. So if somebody did propose, say hypothetically, that the Boys and Girls Club was in the county and not within the city, right? So there's a difference there. And if somebody proposed something within 500 feet of the Boys and Girls Club, then it would be up to the zoning administrator to determine if the Boys and Girls Club would qualify under the criteria that's listed in the code.
So there's a significant amount of discretion that would be afforded to the zoning administrator.
Yes.
I will say, for the sake of the discussion here, I know in the past we've had some difficulties with trying to figure out specifics and what does or does not apply. I would make the argument that maybe that is something we do need to codify to eliminate that confusion about does it or doesn't it work? I mean, and you have far more wisdom in something like that. I mean, does it make it easier for staff if there's a clearer definition or distinction about what can or cannot be permitted, allowed?
And while you're thinking, my experience, the more specific you get with some of that, the more you tie the hands of staff, because I don't think we're gonna sit here and think of every instant that might come up. And if we don't watch it, it's just like you said about liquor stores. We start closing half our liquor stores to try to regulate cannabis, we're making a mistake. And I'd be afraid, and you guys are the ones that write the rules. If you think you can write them perfect and, move forward. But I'm afraid if we go much further than you have, we're gonna tie people's hands.
I would agree.
And if the zoning administrator rules, they can still go to BZA?
Yes, so any decision by the zoning administrator can be appealed either direction. So
Yes.
if they say, that, yes, it is allowed, and then there's a citizen who feels that that was a wrong decision, that can be appealed to the BZA. Absolutely.
And then the circuit court.
Yes.
And then Hannah, go to the next slide, because Joe, this also fits with what you're talking. You see under F Foxtrot, not permitted to be sold in conjunction with temporary zoning certificates. So it's that extra step that things have to be done and approved before sales.
So this is actually something that we're proposing that's above and beyond what the state has specific. The state does not speak, at least not that I'm aware of, to temporary certificates for like a festival or something like that. And we thought it was prudent to put into the county code that you could not have a cannabis booth, for instance, at a festival. So
Okay, so that's even more than what I was
Yes.
thinking. Wow,
Yeah.
okay.
Yes.
Interesting.
So, now, as I said, I have not seen anything in the state that talks
No.
to that scenario.
Yeah.
We thought it worth putting in. Obviously, your decision as to whether you want to keep it or not, but, and who knows if it gets challenged, but.
So you're like at farmers markets or something, or?
Exactly, yes.
Okay. Interesting, okay. But that could be challenged.
It could. Yeah, so the overriding rule that the state has said is that we cannot be onerous to cannabis dispensaries.
Okay.
Onerous is not defined, so,
Duly burdened.
or duly burdened.
Is actually the words.
Sorry.
Yeah.
Yes.
Okay, thanks.
Just gonna go back and wrap up the distance requirements really quick.
Sorry about
No, you're fine. So as discussed, establishing that a cannabis dispensary must not locate within 1/2 mile of another cannabis dispensary, and then a cannabis dispensary may not locate within 100 feet of the property line of a residential zoning district. And just, this note points out that in the state legislation, they give the jurisdictions the options whether or not to institute this 100-foot distance requirement.
Quick
And-
question, if I might, not to
Yeah.
keep us going over this, but I know there was talk with the state of including something possibly about locations of dispensaries. I think it was near residential treatment facilities. Was that included or not? Okay,
Not that I'm aware of.
okay. I know there was something mentioned at one point. Okay.
That was a good point, Commissioner Gordon, to bring that up.
Thank you.
And then continuing on with Chapter 158.059, no variances from the requirements of this section shall be granted. Cannabis products are not permitted to be sold in conjunction with a temporary zoning certificate, and a cannabis dispensary in conjunction with an on-site consumption establishment is prohibited in all zoning districts.
Before you move on, if I may, that's another power that the state gave to the county is the on-site consumption. So there is state regulations related to it, but they did give us the power to prohibit that, and so that's what we have here.
And then just adding language, as discussed, to the temporary seasonal uses chapter, that cannabis products are not to be sold in conjunction with a temporary zoning certificate. And then we move on to the use tables. Just to note that any row that you see highlighted in blue is a new use to be added to that use table, starting out with the agriculture and conservation use tables. The addition of the growing of outdoor cannabis to be permitted in the ag district, prohibited in the conservation district. Again, this is the provision that we must regulate the growing of cannabis the same as the growing of hemp. Removing the use of growing of medical cannabis, adding a use for the indoor growing of cannabis to be prohibited in the ag and conservation districts. Moving on to the residential districts use table, adding uses for the outdoor growing of cannabis to be prohibited in all districts. The facility for dispensing of cannabis, again, prohibited in all residential zoning districts. Removing the use for the facility for dispensing of medical cannabis, and then just amending the use for indoor growing of cannabis, again, to be prohibited in all the residential districts. And then the commercial, industrial, employment campus use tables. Adding a use for the outdoor growing of cannabis that would be prohibited in all of these zoning districts. Removing the uses for facility for dispensing of medical cannabis and facility for dispensing of medical cannabis in conjunction with a growing and/or processing facility. Adding quite a few uses for this use table, but this is due to the provision that we must regulate cannabis dispensaries the same as we regulate liquor stores. And this is how we regulate liquor stores as general retail, as square footage. So cannabis dispensaries less than 10,000 square feet permitted in the C1, C2, C3 in the employment campus district. Cannabis dispensaries between 10,000 and 60,000 square feet permitted in the C2, C3, conditional in the employment campus. And then a cannabis dispensary more than 60,000 square feet, conditional in the C2, permitted in the C3. A cannabis dispensary in conjunction with a growing or processing facility permitted in the industrial districts. And then adding a use for an on-site consumption establishment to be prohibited in all of the zoning districts. Amending the uses for indoor processing of cannabis and indoor growing of cannabis to be permitted in the I1 and I2 districts. And then just noting the additional regulations on the far right column. Chapter 158.002 is our definitions chapter. Chapter 158.048.01 is our temporary and seasonal uses chapter. And then Chapter 158.059 is the cannabis-specific regulations.
Hannah, or Chris either, the permission in C1 is because of the law saying that we have to align to liquor stores?
Correct.
We can't make that conditional?
No. Not unless we want to go back and change or adopt code for liquor stores specifically and treat them the same way.
And we have currently liquor stores in C1 district.
They're allowable.
They're allowable,
I couldn't say
yeah.
if we have them or not.
Because I remember a conversation about a liquor store going into C1 and maybe it wasn't a liquor store, maybe it was a gas station. I can't remember now. Okay, but it's because it's permitted and we have to align in accordance with the law.
This is how we lay out our general retail.
right.
And that's what the liquor stores fall
Right.
under.
Okay.
So that's it for my presentation.
So effectively, we could try to make this more restrictive, but we do stand to leave ourselves open to some kind of legal challenge if that is the case, if we try to go a couple steps further. So by that same vein, if we don't regulate liquor stores, and the state law says that we can't be more restrictive than what our zoning allows for liquor stores, how are we able to put any restrictions on this at all at this point?
So that you're talking about the additional setback restrictions and so on, because
Right,
those are actually state law restrictions. So those, the 500 feet from schools and so on is in the state law. And so we were basically mimicking what the state says.
About liquor stores?
No. This is only for cannabis dispensaries. I'm not aware of distance or setback requirements for liquor stores.
Okay, well, and I apologize if I'm, so by the sense that somebody could challenge us for being too restrictive, right? because state law says we can't be more restrictive than what we do for liquor stores, and because we don't have anything in place that restricts where they can go, couldn't a citizen legally challenge any kind of restrictions we put into place at all because we don't have liquor store regulations?
Before you answer that, because I think, I hear what you're saying, I'm listening to what you're saying, and I agree. I think the answer is do what we're doing with liquor stores, and then above that, do the restrictions that have been put in place through this year's legislation on cannabis, taking away medical cannabis and making it cannabis recreational / medical. It's cannabis. Adult use cannabis, I think, is the term. So it's maintain the restrictions that we have, because we do restrict liquor stores. We have, rules in place for liquor stores. Keep that in place, and above that, provide additional restrictions in accordance with the state laws and legislation that were passed this year. Is that?
Yes.
So it's this and that, not this or that. Does that?
I'm mostly following that, but I get where you're coming from. But again, if I'm a pro-dispensary citizen, and I say, but the county law doesn't restrict this, and the state law says you can't be more restrictive than this, doesn't that give me legal grounds for a challenge?
But the state law says counties and municipalities can impose this 500-foot setback to pre-existing schools, daycares, playground. That's in the law. It says you can do that, and you can go up to a half-mile
between
of a
dispensaries.
restriction between the dispensaries. So that's in the state law. That's our authority for doing that.
We're allowed to do that. We don't have to. We could say it could butt right up against, but we don't. I don't want to say we don't want. I don't want to do that. I want to be as restrictive as the laws allow us to be regarding distances, in addition to what the laws are telling us on how to zone in accordance, or zone the same way we're zoning for liquor stores. So it's both.
I take that point, and everybody knows I want to be as restrictive as possible. Even beyond this, I want to be more restrictive. But I guess I want to make sure that we're not putting ourselves into a situation where we do end up with some kind of challenge based on the zoning, right? I would much rather err on the side of caution than to err on the side of, okay, well, and then I hope I'm making enough sense, because to me, again, seemingly, there is that conflict between, what the state law says about the local control of this, but also what the state law says about the liquor store component of it, which, in relation to that. So I hope I made enough sense. I was trying to get some clarity about that, because again, I don't want to walk us into a legal situation where we say, okay, we're going to impose all of these restrictions, and then somebody says, well, those restrictions, state law says those restrictions are more restrictive than what you have on liquor stores, and therefore I'm taking you to court.
No, so are you looking at trying to be more, your concern on trying to be more cautious on the restrictions that we're putting in place?
I want to be more restrictive.
No, I understand. Well, this tells us how much restrictive we can be. This says you can be up to these distances in restrictions, and you will govern the locations in accordance with how we're doing liquor stores, and that's the C1, I1, all that kind of stuff, as far as the locations. But my question is, are you more concerned about the legal liabilities that we may be putting ourselves into, or?
Well, that's all. There's a lot of other questions that I have relating to this in a general sense, but specifically for this particular moment, I guess what I'm getting to with the degree of restrictions is that if there is a potential for a challenge based on the liquor store restrictions, shouldn't we go the extra mile to make things even more restrictive and risk the legal challenge because we are being too restrictive?
So I believe I'm following your question, and I think what I can say is that the county attorney's office and ourselves, we've reviewed what we're proposing and what we're presenting to you, and we feel that that is in full compliance with the state law. So we don't think that there would be any challenge related to what we're proposing.
Okay.
Now, if you want to go more restrictive beyond, and let me go back. We have also, where there are thresholds, where the county has options, we have proposed the most restrictive that we can within the state parameters. So we feel that we're on solid legal ground for what we're proposing. If you wanted to go above and beyond and be more restrictive than what we're proposing, there is the potential for challenge, whether it's citizen or from the state or so on, because they are very specific as to what the limits are to how restrictive we can be.
So if I was to say, make an argument for including, what do you call it, Commissioner Gordon, a non-licensed child care facility? What would Boys and Girls Club fall under?
An after-school children's organization.
Okay, so if I was to make that argument for an after-school children's organization to include in this, but also the rehab facilities, and also public safety facility, whether it's the sheriff, law enforcement, state's attorney, or what else am I thinking of? Fire and EMS. We could, in a sense, we could realistically add that in, but whether or not that stands is the question.
Correct. Yes, because that would be more restrictive than what the state currently allows for.
But also allows the zoning administrator to use his or her best judgment in interpreting the zoning laws to then determine that the Boys and Girls Club is in fact
A playground or something
yeah,
similar.
Yes.
facility for children. I mean,
Yes.
you know, and yeah, again, giving the opportunity for the zoning administrator and not locking them in, him or her, so.
And I guess,
I know what you're
yes,
saying, and
right.
I agree with you. We do not want to put ourselves in a position of, you know, I want to say, well, legal judgment that, you know, can really bind us by being more or too restrictive in the sense that we're not allowing something that the state law says you will do. You know, that's what would occur. If we, you know, try to say no at this point, the state's saying, well, that's not the answer. The state law is this, so adhere to the state law. I mean, at least that's my view on this, regardless of principle.
And,
so.
and to kind of piggyback that, my concern is their law goes into effect June 1st. So state law goes into effect June 1st. You have, can't consume, can't be at a farm market, some other items in this. If we don't have this in effect by June 1st, or
Right.
we try to be more restrictive and the state throws it out, can somebody be at a farmer's market? Can somebody consume at the store? Or are we gaining more control by passing this than we'd have otherwise?
Yes, to your last question. I'm not sure about the scenarios that you discussed with if this isn't passed and farmers markets and all that. I'm not up on the licensing that the state, I don't believe that the state,
So hopefully we
Yeah.
can challenge that.
yes,
But this way, it's black and white, they
Yes.
can't do it.
yes.
Gotcha.
So I'm going to make this a little bit more interesting. I don't think I need to highlight how dangerous today's cannabis is. I mean, we've all seen that. In fact, our health department was just here talking about what a serious issue it is. And I think it's important to mention that the ordinance we're discussing here is a county ordinance. The municipalities, to my understanding, I think maybe all 8 of them, I'm not sure, has already provided their own city or town ordinances to allow for the sale of it. I know there's a lot of talk about the referendum, but I read the referendum as authorizing and legalizing the use. Didn't say anything about the sale. So I think I know what direction things are probably going in, and I'm prepared to make the motion, But I don't think we should approve any of this. In fact, I think we should go a step further because marijuana is still a Schedule I drug. It is just like heroin, LSD, and ecstasy. And, you know, sometimes states get things wrong. In fact, every state that has gone down this road admits now they got it wrong. California, Oregon, Colorado, all of them, they all say, oh man, we messed this thing up. So if the state's already going to tell us what to do, and they've already decided that they know better for Carroll County, then why even do this? Why not go a step further and say, no, we do not want this sale, and as far as the county jurisdiction is, we don't want to sell it, we don't want it anywhere in our county, and see what happens. What's the worst thing that's going to happen? Because, again, Maryland got it wrong. This is my personal opinion. As somebody with kids, we all have kids, grandkids, we all have our own opinions on this, but I think the state got it wrong. So they're going to do what they're going to do. Let's be honest. In fact, more so increasingly every single session we see they do what they want to do and they don't care what we think. But I still think it's our obligation to do what we think is right for our county. Me personally, I think this is what's right for my district, and I'm going to vote no on this. But why not take it a step further and see what happens? Why not take it a step further and show some resilience and defiance and say, no, we don't agree with this. We think this stuff's dangerous.
The legislation from the state was put in place in a response to the state referendum that overwhelmingly agreed that adult use cannabis should be legal, to include Carroll Countyans. I won't say I wish, I believe that the state got it wrong in the sense that they, in legislation, should have the opt-out policy in place to allow the counties to govern the counties. They didn't do that. That's the dilemma is, I mean, if they had the opt-out policy, then I can see taking another route and having a much deeper discussion on this. The legislation did not do that in response to the referendum that, again, passed overwhelmingly, except for, I think, one county in the state, and that wasn't Carroll. So this is in response to the referendum, to the legislation, to then govern the best way we can to protect our community and be as restrictive as we're allowed to, according to the legislation, and also safeguard ourselves from potential fiscal challenges and all that kind of stuff. Not that that's what I'm scared of at any point. I want to do it right. So I think we're now in a position that we should move forward, and we're governed by the number of cannabis stores that are going to be allowed, adult use cannabis stores that are going to be allowed in the county and the municipalities. It's not going to be many, you know, it's not going to be a cannabis store on every street corner. It's going to be, right now, I think 2 or 3 in the entire county.
It's 4.
Is it 4 now? Okay, in the entire
There's 2
county.
existing in the city.
Oh, I apologize. So 4 total. So 2 additional. Yeah, and there's a grower up in Tawnytown, right?
Correct.
Yeah. So, yeah, I'm gonna just get off the soapbox and make the motion that the board approves the proposed amendments to Chapter 158 of the county's zoning code.
I have a motion. Is there a second? I will second it. So I have a motion and a second. Further questions, discussions?
I have a couple real quick, if I might. Mr. Burke, maybe you can help us with this. As with a variety of things on the state level, they have the ability, not that they necessarily do this in all cases, but they have the ability to affect incoming funds to the county government, be it through the education system, if we don't fund that on certain levels, other things. Is it possible that we could see a negative impact on the county if we were to not follow through on this zoning code?
The state has been known to withhold funds to get compliance with state law
And
in
then,
certain circumstances.
and then the other question, just for clarification, I think I'm correct, but I want to clarify this. When this was before planning and zoning several months ago, there was questions and concerns from planning and zoning, rightfully so, about, why do we need to even put this in place? Can we just leave it be? And if I'm not mistaken from that conversation, we were made aware that if we chose to ignore that, the state actually could allow these dispensaries in other areas than what we would have any real guidance or ability to control or conform in any fashion.
The dispensaries would attempt to locate in the county. We would probably say no, and then they would push the issue up through the courts.
And then the court, and then they would be the deciding arbiter in that then?
We would have no ordinance in place.
Okay.
Another just discussion point, I spent a couple hours, actually, yesterday with a store owner, and to learn more about it, not in this county, I think in Montgomery County. And one of the things he shared a lot with me, but one of the things that was interesting is that these stores are no longer medical marijuana. They are adult use cannabis, or cannabis, I guess. They're adult use cannabis. You're not allowed to sell medically, cannabis for medical use only. You can only sell adult use cannabis. Yeah, I didn't know that.
Our stores in
It's
Carroll
both.
County have
Sell
both.
both.
No, you have to sell both.
Oh, yes.
That's my
Yes.
point, is
Yeah,
you have to
okay.
sell
Yeah.
both.
And they're two distinctly
and they're-
different.
well, the-
Medical isn't taxable, recreation. blah,
Yeah,
blah,
it's the same product, it's just the taxes associated with it. But if you were having a store that was just medically sold cannabis, you have to now include adult use cannabis, and the difference is the taxes. I didn't know that. I was like, why doesn't somebody just continue to sell medically, produced cannabis? And that's why. So, that was a lesson I learned, which was very interesting to me, so.
So I'm sorry.
Go ahead.
You wanna-
No, go ahead. I have another legal question, but go ahead.
So I was just going to say, if you want to ask the question first, because I'd like to offer an amendment, but if you want to,
Okay. Several people have asked, has our county attorney advised us that we're breaking federal law but following state law, and even though 20 states have done it, we're at risk for whatever, being arrested, being...
That's sort of the Alice in Wonderland situation you're in here. Regardless of what you do today, regardless of what the state did in the referendum, this is still a Schedule 1, presently a Schedule 1, could be Schedule 3. That doesn't move the needle for this discussion.
Yes.
It's still illegal under federal law. You can't grow it, you can't dispense it, you can't possess it, all illegal under federal law. And federal authorities could swoop down tomorrow, close down all of the shops and grab all the fields and arrest people under federal law for this. But it's legal under Maryland law. So your state police, your local town, county police, sheriffs, they can't enforce the federal law, and there's no law for them to enforce in most cases, on marijuana. So can you go to jail? No, you're not growing marijuana, you're not dispensing it, you're not...
So the dispensaries or the growers could...
Yeah, they're doing this all at their own
Federal-
risk. You're not doing anything.
Okay.
So I take Commissioner Gordon's point that we need to have something in place. We dealt with the same thing in Tawnytown, what, 9 or 10 years ago now at this point? So I certainly take the point that we need to have something restrictive in place, because otherwise it's a field day from the state's perspective. I take that point. And yes, certainly, Commissioner Rothstein, to answer your previous question, yes, certainly some of this concern is principle, absolutely. But there's also a lot of it that's practical as well. Back over the late autumn through the winter, there was that ongoing discussion about, ending in last winter, but beginning last summer, there was a discussion about rehab facilities, what they actually stood to be defined as a part of or under the auspices of. So the amendment that I want to offer, hearing everybody's thoughts on it, The amendment I would like to make a motion to offer is to expand the restrictions in what's being proposed to include distances with non-licensed after-school facilities, drug rehabilitation centers or clinics or homes, public safety facilities to include a law enforcement, corrections, state's attorney's office, courts, and fire and EMS.
Can
Add
we-
those as restrictions.
Can we direct staff to look at this and then take it to the planning commission to then make proposals forward? I mean, how would that work?
I don't believe that you would need to, in that this doesn't, and Tim, please speak up if you disagree, but this does not sound like a substantive change to what is being discussed, so I don't believe that you would need to go back.
But it is a substantive change to what the state law says you're allowed to do.
Right.
So.
That's my concern.
The state law, if you want to be bulletproof, the state law would need to be amended to have those listed as well as the current ones.
Well, then I will say that I will be voting against this because I really do believe that we need to be more restrictive, so.
And I understand what you're saying. I think, I don't know if naive's the right word. Unfortunately, I have a relative who's in trouble right now. He bought his Coke in the recovery house. So I'm not sure we can protect them and why we choose to. But I understand. Yeah, I understand, but, yeah.
Could you, real quick, could we bring slide 3 back up for a quick second?
Is that the slide?
It was the proposed section changes 158.095 for locations such as library.
Yeah.
Okay. To your point, Commissioner Vigliotti, and I was just trying to rethink this a little bit, and obviously it would go before zoning. And obviously we were talking about an organization just as an example, not that it's solely that organization. But I kind of was looking back at this, and while some of those organizations aren't licensed childcare centers, I think they probably, and I don't want to assume anything for somebody else's interpretation, but I wonder if they'd fall under a recreation center, because there would be recreation, like, granted it's in Westminster, but like the Boys and Girls Club of Westminster has a gym. So they have a recreational component, so it's not separate. So I'm wondering if they, in Annapolis, might have crafted the language in this to sort of cover it without being completely specific in that fashion.
Yeah, trying to catch more.
Yes, yes, versus honing in on one or two specific areas.
Might have been.
Just a thought I wanted to mention.
And I'll just say, I guess maybe as a concluding thought for myself, I, certainly respect and understand anybody who is supportive of this, because again, we need to have something in place. And again, to borrow a phrase from Commissioner Connor, in my humble opinion, it just doesn't go far enough.
And I agree. But I don't know.
What, that his opinion doesn't go far
I'm ready
enough?
to draw the line in the sand because I go, and you were talking about the states making mistakes, like Colorado, our county could make our decision and not allow it.
Exactly.
But they've made a lot of mistakes, but they haven't undone it.
Right.
And I was disappointed. I thought Maryland could learn from some of the other states' mistakes, but they didn't seem interested in that. This is tough.
Yeah, and again, the counter argument I make to some of the comments that have been made recently is just remember, and my thoughts on the referendum, I made those clear. That was, for me, about use, not sale. Regardless, let's remember, you will still be able to buy it in the county. I'm just simply referring to our jurisdiction, the Board of County Commissioners jurisdiction, and our purview is those areas. And again, it may be it may not be a really effective argument, but you'll still be able to buy it just about anywhere. I mean, let's be honest. So, I mean, if anybody wanted us to make the argument that, well, I live in Carroll County and I can't buy it, that's just not going to be a good argument. People get in their cars, drive all the way to stores far away to do things. So I just don't buy that. You don't have to, you can leave the county anytime you want to go do whatever you want.
Okay, so we have a motion and a second. We had amendment with no second, so we have the motion and a second. Any more discussion or questions?
I'm just going to make two quick comments. As I mentioned earlier, the financial implications concern me. I'd be remiss not to say that the concern for safety and those in the community concerns me, but I'll add a third. Us doing nothing gives them authority, and I don't like that idea. I'd be very open to the thought of having some additional conversations with our legislatures for next year. I realize it doesn't solve the concern now, but to me, doing nothing, still doing something, and I don't want to see that taken out of our hands, and that's what really concerns me at the end of the day.
And I guess if we do pass this, we can still keep fighting the state.
Yes, I would think.
We don't have to give up on that.
Oh, I absolutely agree. We should keep the dialogue. So,
Any more discussion? All those in favor?
Aye.
Opposed?
No.
So 3-2? Passed.
Thank you for your help.
thank you.
Item 4, exercise option to purchase Royal Legacy Program for Jerry and Brenda Day.
Good morning to both, no, good afternoon to both of you.
Afternoon.
Yeah, I was expecting to say good morning.
Have you had lunch yet? Are we holding you up?
I'm fine, I'll make it.
You haven't either, so. We're all good.
Oh, my.
Good afternoon, Commissioners.
Good afternoon.
Good afternoon.
Just want to start out by saying, I think I mentioned last time we were up here, just last week, that we're at 79,766 acres. Today, we come before you for final approval of Rural Legacy Program easement. The Rural Legacy Program is 100% funded by state grant funds from the Department of Natural Resources. We have two rural legacy areas, Little Pipe Creek and the Upper Patapsco Rural Legacy Area. We use a points-based appraisal valuation to determine the fair market value. There are no soil qualifications in our rural legacy program, and we can work with small or large farms. Today, we'd like you to review and request approval of the Gary and Brenda Day property in the Upper Patapsco Rural Legacy area. This farm is located off of Daverill Road in Hampstead. There's 61.787 acres. We're retiring 5 lot rights. Fair market value of the land only was $420,547.57 per our Rural Legacy points-based appraisal. The cost to the grant is $294,383.30, which works out to $4,764.49 per acre, which is 70% of the fair market value determined by the appraisal. And this is all paid for with 100% grant funds. Here's where the farm is located on the right side of your map along the county line between us and Baltimore County, and where it's located in relation to other eased properties in the county.
Property on the north, is that still also their property?
On the north of the red?
Yeah.
No, there are other properties owned by other
Okay,
people.
okay.
But they're probably eligible for
Yeah.
some type of program. So we've got the opportunity to build on this
Yeah,
property.
okay.
Here's a picture of George's Run that runs across the south side of the property. And again, we're here today to request final approval of the Gary and Brenda Day Farm located off of Daverill Road in Hampstead. 61.787 acres, retiring 5 lot rights at a grant cost of $294,383.30.
You want to take the honor, because it's District 2?
Sure. I move the Board of Commissioners exercise the option to purchase a Rural Legacy Program conservation easement on the Jerry and Brenda Day property in the amount of $294,383.30.
Second.
I have a motion and a second. Any further discussion? All those in favor?
Aye.
Opposed? Thank you.
Thank you, Commissioners.
Thank you both.
Well, so that was all state grant, I'm kidding.
Have a great day.
You too.
You too.
Item 5, decision on the closure of Babylon Road Bridge. I think I've heard of this before.
You've been here before. Hi, Commissioners. We're here looking for a decision on the closure of Babylon Road. On Thursday, November 30th, 2023, the Board of County Commissioners held a public hearing about the closure of Babylon Road, specifically the bridge. The bridge is currently rated in fair condition. Carroll County has started the design process of the replacement, and due to the current site conditions, the cost of the replacement has increased significantly. At the conclusion of the hearing, the board kept the record open to receive additional comments. At this time, I'm here to answer any additional questions we have regarding the closure or the design process with the Bureau of Engineering.
You and I and Commissioner Vigliotti, I think it was just 3 of us,
Yes.
met with the owner that controls the land where this bridge would be replaced. And he talked as if he was open to talking about, he actually said giving it to the county, but selling it to the county, doing whatever. You've since met multiple times and he's not interested?
We discussed an alternative route for the road. The county owns significant easement through the property. The design started back in 2014, maybe probably a little earlier than that. We had originally a plan to bypass the entire property that was there, but after doing some further investigation, there was a lot of wetlands in that area, and fast forwarding to our January meeting, even that new alternative route that we looked at, which would involve a property swap, still had significant wetland improvements or wetland impacts that the state would not approve.
And if this becomes a yes, there's an existing bridge there that
Correct.
you're inspecting regularly, and the intention would be to leave it open as long as that bridge is safe.
Yeah.
And then physically remove it?
Yes, we would remove the structure and the abutments.
What's the expected life of the bridge at this point?
It's unknown at this time. I mean, we could have a pretty heavy storm with lots of debris, and it could take it away tomorrow.
Is there any more modifications that could be made on the bridge to extend its life, or no?
We'll continue to monitor. There are some maintenance things we continue to do, minor maintenance. It gets to a point where minor maintenance becomes major maintenance, and then you're rebuilding half the structure, replacing, and then we're now in the cost of half of a new structure.
Right.
So we're going to continue to do minor maintenance on the structure to keep it open as long as we can.
So understanding, I apologize, Chris.
No, you're,
So understanding that cost, and again, the resources necessary to do exactly what you said, to where it gets to a point, a decision has to be made, saying, okay, stop, and that's gotta be very clear, as opposed to continuing on, because that just ends up being like this mission creep of putting Band-Aids all over this thing, and,
2016 was the last big Band-Aid we put on there. We fixed the abutments. The bridge was in poor condition. We brought it back up to fair.
So outside of either closing the bridge now or keeping it open as long as humanly possible, are there any other options that we have if the property owner is not cooperating?
I don't think one that the county typically uses.
Eminent domain. Well, it's unfortunate that we're, having a discussion. I know there's 60-some people, I think, who live back down that road who rely on this bridge. You know, I'll speak for myself because I don't throw anybody else under the bus. I was hoping that we could come to a point of reason and you know, cooperative spirit of agreement with the, you know, the property owner, but it seems like that's not possible, at least at this time. So if nobody else has any thoughts on it.
Just one other, so to go a step further from Commissioner Crow's comments, so we can't buy it because it's not for sale, and we can't, if it was for some donation is not the right word, but done that and then reciprocated, I don't know if we can do this or not in terms of, you know, tax reductions and things of that nature. If those two things, if that's not an option, why isn't it for sale? I mean, we've gone through that, we've gone down that road, no pun intended, already. Okay.
Yeah. Why isn't the property for sale? I'm sorry.
Yeah, I thought that was a discussion at one point, but it sounds like that's not in the cards right now.
Mm-mm.
The sale of the actual, okay. All right, that's it, thanks. Just wanted to clarify.
Well, obviously, you've got the 60-some residents or homes back there, I can't remember which, but you mentioned, obviously, there's significant concern on this bridge on a consistent basis, be it a major storm, whatever. If this were to be affected and cause the bridge to no longer be functional, let's say we get a horrible storm, something to that effect, what scenarios play out for those other individuals living back in that area at this moment if the bridge is immediately, for whatever reason, we'll say a storm, shut down?
Sure.
I mean, I know there's some other roads in that area, but obviously from the fire and EMS side, if I remember correctly, the response time is exceptionally high versus what the standard is, if I recall correctly from our previous conversations on this.
They're, from the fire side, we believe from the north, they would be first due anyway. If you do make the decision to close it today, and then the decision, then it would be closed at a time it's no longer serviceable, we'd work with fire and EMS to determine, is Tawnytown closer, is Pleasant Valley closer, who is closer, do they need to adjust their response routes? But the fire company to the north, in adjacent jurisdiction, I believe they're coming from the north. So they don't have any longer response time than they would if it was closed. It would be Pleasant Valley who's first due, and they're right on the edge of Pleasant Valley and Tawnytown. So unfortunately, this is at the longest traveling distance for any of the companies, being such a rural area and spread out as those companies are.
The travel times for all three companies with the bridge in place are all within a couple minutes. We're looking at the 11 to 13 minute range.
We make a decision to go with the recommendation of, you know, taking the bridge down when unserviceable, and it takes a year, 2 years, whatever it may be, we have the ability to revisit this if this gentleman was convinced otherwise.
There's a little bit of a ticking clock here. For state funding, this project is eligible for approximately 80% reimbursement, and that is only good till 2027.
So basically, we have till a certain point, knowing that ticking clock is there, for those 60 residents to be more convincing in the community.
Well, that's to have the design to a certain point. If you decide to close it, and we don't have the funding to replace it, then State Highway was going to stop the design project. They're going to say, you owe us $150,000 or so money for the design you've already done, and there will be no other design or replacement. That process is going to stop.
How quickly? In a month, and
We can delay it. We can delay it for a little bit, but we have monthly meetings with the Office of Structures, and it's on our monthly agenda, and they keep asking us about it, and we keep telling them that we're talking about it. So I think it would take State Highways several months or longer to figure out exactly how much we owe them. And then we'll go back and forth and argue about exactly how much we do owe them. So we do have some time, but not to 2027.
Take it off the agenda. Don't bring it up.
Oh, the monthly agenda.
The monthly agenda. We don't always set the agenda.
I understand. But, yeah, I mean, a decision we can make today, the ticking clock scenario, understanding we do have some time
We do.
to make a change to meet the needs of that community. It's in the hands of a decision of a landowner at this point, because use of eminent domain is not, something I believe, for me and my colleagues would want to use. It's been used once for safety only, and that's, the situation we're in, so.
And I'm totally opposed to eminent domain. But if I weren't, that process, we could lose, that could run too long that we'd lose the state money. That's not a quick process, particularly if he decides you can take me to court.
There is a process to escrow the funds, and then you can continue with the project, and then the escrow court or the courts decide how much it is going to be, and we can still proceed. State Highway does that fairly
Okay.
frequently with their projects, where they don't have agreement. But we also have, because we have federal dollars in play, we have certain requirements in regards to land acquisition and discussions we can and can't have, and when we can have those.
And if you keep designing, it just means we need to give them more money back.
Yes.
What do you think?
Well, I will make a motion to keep the Babylon Road Bridge open as long as is safely possible and structurally sound to do so, while continuing efforts to seek a permanent resolution to the issue.
Second.
I have a motion and a second, and
So we're not talking
what's
about
that
closure?
mean?
Yeah.
Yeah, they'd have to come with funding.
If
Yeah.
the, and you've seen the bridge, it's at a weird angle, and there's potential for washouts. If it washes out in a year or two and nothing's settled, it's closed. Is that?
Well, right, a motion to keep the bridge open as long as is safely possible and structurally sound to do so, and at the same time continuing to try to find a permanent resolution to the issue.
What,
I'm not sure what that means.
yeah, I mean, is it gonna, what do you mean by a permanent resolution to the issues? We need more
Trying to-
direction. Do you want to leave the bridge open so we continue engineering and going down that path? Or do you want not to, so we stop those efforts?
Well, no, the suggested motion that was presented to us was to leave it open until such time as the structure is no longer serviceable.
To
To
close.
close it until at such time as it's no longer serviceable. I'm saying we're going to keep it open as long as it is safely possible to do so. Because what I'm getting at is that, as long as the bridge is serviceable, I believe that we should continue trying to deal with the property owner to try to find a resolution to the situation. So in other words, basically taking the recommended motion and elaborating on it. I want to make sure that we don't end our efforts, that we don't just say, okay, we're going to leave the bridge open until it's no longer usable. I still want to try to find a solution to the problem.
My problem, did we get nobody second, right?
Yeah.
You did?
So why not
Well, let me,
take a look at this and saying closure, and then the second part you just said?
well,
I
and,
Yeah.
and again, I think,
think I know what you're saying.
if we do the recommended motion, then I think everybody knows the clock's ticking. If people on that road want to talk to that landowner, if they want to do whatever, but if we make the motion too soft, we're taking him back off the hook, and we're not going to get the land.
Right.
You know what I'm saying?
I certainly do. I think it's
What you
just
mean, but
different
nothing
wording.
precludes them. If he walks in here next week and says, I'll give you the land, we're probably gonna do this. I understand. I understand. Yeah, this isn't, yeah, I understand. But what I'm saying is, that's what means we can close the bridge or not. So, I'm not sure.
The choice in wording is to demonstrate to the citizens back there that we're going to do what we can to keep the bridge open as long as we can. That's simple. And then also reiterating our desire to find a resolution to the issue. It's basically taking what the recommended motion is and expanding it.
But we have to be willing, so I apologize, before this, so we have a motion and a second, so it's discussion.
we've got to be willing to say, I believe, that we're at a position to close this bridge, to keep it open until it's unserviceable, and when it is unserviceable, it will be closed. And during that time, it's out of our hands, it's into the community's hands on what they want to accomplish. But right now, we can't be thinking we're going to be feeding this bridge, because it's going to be closed. We got to be willing to say, close the bridge when it becomes unserviceable, and continue to have a dialogue with the community, but it's really the community's work to determine how to resolve this. It's not ours anymore.
So if I included the phrase "close when necessary" into the motion, would that ameliorate the, okay.
I think so.
All right, so then I'll restate the motion if Commissioner Garen's okay with that, because he was my second. The motion I'll amend then is to keep the Babylon Bridge open as long as is safely possible and structurally sound to do so, closing when necessary, while continuing efforts to seek a permanent resolution to the issue. Is that okay with you?
Absolutely, sure. Second?
Okay, we have a motion, a second. Is that a viable motion?
Yes, I believe so. I mean, it was a petition for a road closing, so there has to be
Right.
some element of closing in there.
Right.
Or else they're going to be on the hook for continued obligations.
But we know you're going to close the road if it's not safe. So that's
Yes.
kind of irrelevant,
It's a
right?
given.
I mean, that's you just doing your job. So that's why I think Commissioner Vigliotti's motion makes sense.
But this motion doesn't mean they need to be designing a bridge
Right.
that they
No, it's-
can't build.
Well, they wouldn't be able to do something different with the bridge there, because to build like a new bridge in that location would not be possible, wouldn't be feasible.
Yeah.
So that's why, that was the aspect of the motion,
Yeah,
trying to
but-
find the permanent resolution to the issue.
Okay, we have a motion, a second. All those in favor?
Aye.
Opposed? Thank you.
I think we got the same result.
Thank you. Thank you, guys.
You're in there.
And thank you, residents.
But you
Um,
said the same thing, so.
Item 6, contract award Greenmount Church Road pipe and head wall replacement.
Good afternoon.
Good afternoon.
The Office of Procurement, in cooperation with the Bureau of Engineering, requests your approval to award a contract to Stanballs Incorporated for the Greenmount Church Road pipe and head wall replacement in the amount of $52,370. Stanballs Incorporated is an approved term contractor that was competitively bid. This amount is within the adopted budget.
I'll move that the Board of Commissioners award the Greenmount Church Road pipe and head wall replacement to Stanballs Incorporated in amount of $52,370.
Second.
Have a motion, a second. Any further discussion? All those in favor?
Aye.
Opposed? Thank you. Now we're going to look at repairs to the corn crib and alms barn at the Carroll County Farm Museum. And I'm just proud to be able to be dealing with people that know what a corn crib is. It's, everybody visit us, you park under the wagon shed? I said, it's a corn crib. So,
The Office of Procurement, in cooperation with the Bureau of Building Construction, request your approval to award a contract to AJ DeLuca in the amount of $85,390. This award will consist of two parts. The first is to clean and repaint the Alms Barn roof and replace the gutters. Secondly, this award will be to replace the roof on the corn crib with a cedar roof. AJ DeLuca is one of the county's approved term contractors that was competitively bid, and this amount is within the adopted budget.
Don't
Motion
need
to-
this, go ahead.
You want to do it?
Nope.
Motion to award a contract to AJ DeLuca for repairs to the corn crib and the alms barn at the Carroll County Farm Museum in the amount of $85,390.
And I'll second that, and the only discussion I do have is explain what a corn crib is, very briefly.
A corn crib is,
he's from New Jersey, just try to,
We got corn, Jersey corn is
Place where you
awesome.
hold corn.
Come on.
they used to pick ear corn, and then the ear corn would need to be dry, so you would put it in the corn crib, which is a structure that has slats that lets air blow through, and then you pull the corn out and feed it throughout the winter to your animals. So it houses the corn for the year.
Got it. Commissioner Kyler had no idea.
I've filled them. which you don't see too many of that
No,
anymore.
you don't.
What, you doing physical
You
activity?
don't see me doing it, but yeah. Oh, my gosh, I have a motion and a second. Any more discussion? You don't want to contribute to him? All those in favor?
Aye.
Opposed? Thank you.
Thank you.
Item 8, approval to purchase land acquisition easement for Carroll County Regional Airport.
Good afternoon.
Good afternoon, Commissioners.
I'll ask a side question while you're getting your paper. Why were you at the community college to see the Carroll County Sports Hall of Fame, and you made me look at it? It looks like they haven't done anything since COVID.
I was actually at a class for HR over there, and it was right outside the.
Oh, you're
the
taking
classroom
class
there.
over there?
Yeah,
Cool.
Taking a class, and it was right outside the room I was taking a class in.
Oh.
We're getting close on this. This is good.
Again, good afternoon, good Commissioners. The Department of Public Works has negotiated to purchase land and a permanent navigation easement at 457 Pleasant Valley Road, Westminster, Maryland, containing 7.4 acres of land in fee simple and 7.6 acres of land for an navigation easement for $247,000.00. The Board of County Commissioners has advertised its intent to purchase the property. The land is being purchased in connection with the Carroll County Regional Airport Runway and Taxiway Relocation and Safety Enhancements Project. The FAA will reimburse the county 90%, the MAA will reimburse the county 5%, and the county will pay 5% of the purchase price.
And I always ask this, but we'll end up having to purchase it. We'll furnish the cash flow, and then we'll
Yeah.
be reimbursed.
That's
But
correct.
you know we're being reimbursed.
That's correct.
Motion to approve the purchase of land and permanent navigation easement at 457 Pleasant Valley Road, Westminster, Maryland, 21158 for $247,000.00.
Second.
Have a motion, a second. Any further discussion? All those in favor?
Aye.
Aye.
Opposed? Thank you.
We have one left.
Thanks.
We are now,
Eric?
oh,
We have one left
I'm
property?
ask him what an airport is.
We have one property left?
Two.
We have
Two.
two.
So we
Okay.
didn't know what a corn crib was.
You're this close.
Go to work. Thank you.
Thank you.
Getting there.
And we're now at public comment, and public comment is not question and answer. They get 3 minutes, and Chris, do we have any callers?
No callers on the line, sir.
Okay, so it's, please read the cards.
Catherine Adelaide.
Hello, Commissioners. Sorry I had to duck out. We're canvassing mail-in ballots today also, which has its own set of challenges, but I decided this was more important. So obviously, I'm sure you know, I'm very disappointed in that final outcome. I did want to just clarify a couple of things. The referendum, again, citizens cannot vote, for example, to have slaves in a referendum, in a state referendum, let's have slaves, and then commissioners sit up and go, but the people want this, the people want this. And I won't embarrass anybody, because most people don't know the reason that we can't all have a slave, even if the state passed a bill and had a referendum. We all, 100% of us said we want a slave, because of a thing called the 13th Amendment to the Constitution, which prohibits slavery. So this is a direct parallel to when the feds make a law and the supremacy clause clearly states that a federal law is supreme over a state law. That's why it's not the United States of Maryland, it's the United States of America. So that referendum argument, I'm very disappointed that that was made. But I don't really blame anybody, because quite frankly, we've all been deceived, myself included, and it's just hard to admit that, you know, we made a mistake in accepting so much of this, and I'll include myself in that. But once you understand the law, the simple black letter available to everyone, you really don't even need a lawyer in this case, but I do appreciate your lawyer stepping up to the plate and making that very clear that it's all illegal. The second issue I heard is the idea that there was no state opt-out by Maryland, that somehow the other 3 states that allowed states to opt out of this insanity made that okay, but this not. okay? So you don't need the state to give you permission to not do something that's already illegal. So I really would hope that factors in somewhere, that when the state of Maryland is already doing something that's illegal under federal law, the evidence there would be that the state of Maryland is more of a drug dealer and wouldn't even acknowledge federal law. The states that gave an opt-out, they did that because they knew what they were doing was illegal. So they had the decency to give local governments an opt-out. So I'm sorry that that became an issue. But again, I don't blame anybody because it's meant to deceive us. I do appreciate the 2 votes against it. In terms of procedure, I think in the future, and I certainly intend to make this an issue for however long I stay elected, because it's in our platform, and I'll be fighting that this weekend. But procedurally, I would have liked to see, and I appreciated your concern, and you seemed to be moving in that direction, would have been for a motion to ban it to ban it temporarily and have a moratorium on it. You would have had some blowback from the state, but so what? Let them spend their millions of dollars and prove to us that anything's legal here. But I would have liked to have seen a motion and a second to go ahead and follow the federal law. Oh, am I up already?
Yeah.
Sorry.
Finish your thoughts.
Okay.
Counting to 15.
But to follow the federal law, and then that would have solved, I think, your problem. So I was disappointed that we didn't make a motion to just make it illegal under the, the zoning ordinance and say, this is not a permitted use in Carroll County as long as it's illegal on the federal level. And that would take you off the hook on everything. Instead of, it seemed like it was a fallback position, like, okay, well, let's just go ahead and legalize it. And we didn't even get your provisions that you were trying to put in. So, thank you.
Thank you.
John Hilbert. Are there people outside, Dave? Okay. Hilbert. Lynn Wheeler. Dr. J.D. Murphy.
Hello, I'm Dr. J.D. Murphy. I've been an Eldersburg resident for 29 years. I love this county. I went to public schools. My husband did. Our 3 kids go to public schools. We've been involved in the rec councils. But I'm not going to sit and be silent when there are issues going on in this county. I mean no disrespect, but as a pediatric healthcare provider, I'm greatly concerned about the impact of some of the words and choices that this county has made that has greatly affected our children. So specifically, I am faculty at the Johns Hopkins University School of Nursing. I am the lead of our pediatric acute care nurse practitioner program. So every piece of curriculum that is taught to these students, I have to review. That means I need to be up to date in all the latest evidence-based practice. What are the problems, what we can do to fix them, how we can best help keep our kids healthy and safe. I'm also on the board for BHIP, which is Maryland's Behavioral Health Integration in Pediatric Primary Care. You might be aware that there is a significant mental health crisis going on, and we do not have the providers available to address this. And so this program is meant to help educate pediatricians, pediatric nurse practitioners, pediatric-focused physician assistants to best be able to treat mental health conditions and to help protect our kids. But this is all reactionary. So the point that I'm trying to make is that there have been 3 teenagers in Carroll County this school year alone that have committed suicide. I appreciate your placard there for the suicide hotline, but we are, whether intentional or not, we are disproportionately affecting our most marginalized kids in this area. We all have our own personal beliefs, we all have our own religious and political views, but the fact of the matter is that minorities, whether that's a religious, a racial, a political, or a member of the LGBTQ community, they're significantly more likely to commit suicide. And we know, the data shows that children that feel supported by their communities, their school systems, by public rec programs, that's such a protection measure that can significantly reduce these suicide rates. And yet our county has passed pride flag bans. Our county has singled out books that are statistically significantly focused with protagonists that are of these minority groups. And so, there have been words about sending a message. That's the message that we're sending to these kids. And so I hope that you consider this. I hope that you continue to talk about this. I hope that you continue to hear what we're saying as the pediatric mental health community, as parents in this community, as people that all of us in this room really care about kids, that we need to make sure that we're caring about all of our kids, not just some of them. Thank you.
Thank you.
Just not to go back and forth, you reached out to me, I believe.
Thank you.
Absolutely. Do it again. I want to find time to
Thank you.
sit down with you,
I
okay?
appreciate that. Thank
Okay.
you.
Pam Zappardino.
I'm short. Thank you for your time. I appreciate your being willing to listen. My name is Dr. Pamela Zappardino. I've been a resident of Carroll County for the past 23 years. And I'm here today to talk about what was discussed very early on by Mr. Kyler when he made some comments, the funding of our county public library system. From what I gathered from Mr. Kyler, the work is still in process. I would hope that we make quick progress in restoring that funding to the library without question. The library has more patrons, our county library, than any other library in the state, which means almost all of our county citizens are using the library at some point in time. And my concern is that this discussion and how it turns out is potentially having a negative impact on our entire county population. Whether we're talking about young children who take advantage of story hours, school children who need to do research, adults who love our library, senior citizens who use the library. Every single person in this county has a vested interest here. And I think to even contemplate not funding the library is seriously problematic, and I hope you decide not to go in that direction. Thank you.
Thank you.
Catherine Kelly. Daniel Carnaggio.
Hello, I'm Daniel Carnaggio. I'm a professor of mathematics down at Carroll Community College. And I'm here to talk about the budget for the library, because Commissioner Kyler, you said some things that were very kind of disheartening at the beginning of this session here today. You said that a lot of social media was very disingenuous with their what they have stated about what's going on with the library. I'm going to take the data straight from Ted Zielinski, whom I went to meet with when he went over his budgetary meetings prior in, I think, earlier last month. But the data that he said that is that we're getting a $169.2 thousand increase to our library budget. Now, this is half of what you normally match for an increasement for our library's budget. I believe he said last year you matched it with their required 3% increase. He said that for next fiscal year, that is supposed to be a, again, proposed 3% increase. This year, you're matching a 1.5 increase, not the 3 that they require, but 1.5. This is, in fact, a decrease, a 50% cut to our budget, to our libraries, which is very clearly what people are hearing online. So I find it very disingenuous for us here at this board to say that what our fellow community members are saying to each other is disingenuous and to not trust our fellow, citizens, which is kind of iffy in my opinion. To that extent, I would like to also point out that as a mathematician, I find it very disheartening how the data represented in the PowerPoints that were provided by Ted Zielinski are very strangely paced out with how they have their units. For example, I mentioned that the library budget was stated to have a $169.2K increase. For an example, I believe this for the police pension, they labeled it as a 0.2 million increase. For reference, for those who don't know, 162,000, which is 162.K, is less than 0.2 million, which is 200,000. The data is very manipulated in the presentation of what you are giving to the public via our own offices here. So I really, really, really would like to advocate here that you listen to what the community is saying. What you see online and what you hear here is what the community wants. We want our libraries funded. We want our libraries to continue to support our, our citizens, our lower income citizens, and people that really use these libraries. If you take that away, you're taking away stuff from our citizens. And it's very important to note that I believe, I forget who said it, but somebody said earlier that Carroll County is best in the hands of Carroll Countians. Please listen to us and don't try to deceive us with the numbers that you're presenting. It's very disheartening to see that in your own presentations for what we have here. Thank you for your time.
Thank you.
Pat Page. Matthew Davis. Emily Ann Craighead.
Spelling is terrible.
I'm sorry?
I'm terrible at writing. Don't worry about it.
I apologize.
It's okay. I used to work at an elementary school, and my handwriting was worse than most of the fifth graders. You're fine. Hi, everybody. Thank you for giving me the chance to speak today. I come here as a concerned citizen of Carroll County. I've lived here the entirety of my life, and I wanted to talk about the decisions that's been made in regards to the budget for our libraries. Getting right to the point, I know there were a lot of things that discussed, but I wanted to talk more about the choice of using the reinstatement of late fees as a roadblock to further library funding. The thought process was stated several times on Tuesday that this would teach responsibility to library goers, but the library already has steps in place to assure our responsibility. From my own personal perspective, it, I think, will more likely spread ill will rather than to teach any kind of life lessons. Currently, when a library book has been out for too long, which I'll admit life gets busy, I've done that sometimes, they will put a replacement fee for that book onto my account. They will assume that I have just lost it, and then I can't check out again until I have either paid for the book or turned it in. With this change, I have gotten so much better at returning books. I am accountable for exactly what I should be. If I have books out that I can't turn in on time, I shouldn't be able to check out. And if I can't return them, I need to pay for them. That is taking natural consequences for my own actions. Back when there were late fees, I know plenty of people who just avoided libraries altogether. To some of you, that might sound kind of silly, but late fees can be really discouraging. They didn't teach responsibility. That's something that our parents and our teachers would do. They taught avoidance, and there is plenty of existing research into that matter. I want you to think about how many stressed out mothers and overwhelmed fathers were relieved when late fees went away. Think about the older folks or the disabled people that don't have access to their own means of transportation. And don't even get me started on the low-income residents of our county who cannot treat time or money as a commodity. What message are you trying to send to these people here? That punishment is more important than pushing funds back into our own community? You talked about responsibility, but you teach responsibility to children who now legally cannot be charged with library fines. Us adults are already grown. We've already learned those lessons. This will negatively impact your libraries either because they'll be missing out on future funding that could be used to improve the services that they provide, or because they will agree and then harm the trusting relationship that has been forged in the years since the fines have gone away. I love my library, and if I want to keep my nose out of my screen, I can go to the library. If I want to attend cool programs and learn new hobbies or learn about local history, I can go to my library. If I'm feeling separated from my sense of community, I can go to the library and meet new people I never would have otherwise. And so I would just like to implore you to remember what an incredible community space we have going here with our libraries, and to keep that in mind when you consider withholding future funding for something like this. I know you're not making cuts, but this is all going to go back into a place that is a wonderful community that we use all the time.
Thank you.
Beth Gray.
Pardon me while I get my
notes together. Good afternoon, Commissioners, and thank you for hearing from us. I am also here to speak about the library funds. I'm staunchly opposed to the decision that you made on Monday regarding the budget. And I will start by saying that giving an institution fewer funds while expecting more from them is backwards. We know this sets us all up for failure. The motion that I understand demands three things: return to fines as punishment and as a revenue stream, have libraries open on Sundays, and, quote, to send a message. Well, messages were received, but they're confusing. The arguments against the motion that I heard in the discussion claim that at least 20 of 24 library systems in Maryland have given up book fines because it costs more to collect and bookkeep than they bring in. This fact seems to be in dispute, and I'd like to hear explanations about that from the library director. If the Sunday hours aren't kept, I can only assume it must be a funding and staffing issue. And we know those issues are complicated. And those choices are in the purview of the Carroll County Public Library as an independent agency. So hard budgeting choices obviously have been made. I am glad for your check on the accountability of our tax money. I know $120,000 was mentioned. We all want to know where our money is going. And so I appreciate that. I don't appreciate what appears to be a micromanagement and the implied messages that seem to be being sent. Hard choices are a cold, hard fact of doing any business. Sometimes our personal priorities line up to them, and sometimes they don't. We need and we want you to try to resolve your differences with the library system and put our money and your time to good use. People will respond much better without implied threats. Don't give our county institutions less money while demanding more of them. And please, find a way to get your answers without punishing the citizens who use this system to its fullest on a regular basis. And with my last remaining seconds, I just want to remind you how important the library is to everyone in the community. And a lot of those groups were mentioned by other people. And I'd like to also mention that tonight at one of our local branches, we are going to have a world-class physicist here to talk to the community of Carroll County. And we wouldn't have that without our libraries. For free. Thank you.
Thank you.
Katie Townsley. Oh, wait. Oh, sorry, Ann Townsley. I turned the card over too fast. And then Katie.
Good afternoon, Commissioners. I want to state that I'm here on my own time. I'm not here as an employee. I'm here today as a citizen, as a taxpayer, as a lifelong Carroll Countyan, and as a lover of my library. Ruth Bader Ginsburg so eloquently said, "Speak your mind even if your voice shakes." I can tell you, last 48 hours, my voice has been shaking an awful lot. And fight for the things that you believe in, but do it in a manner that leads others to follow you and join you. I didn't start any of this. This was the community. And for you all to see the 100 people who were here this morning who had to leave due to time constraints says something. The 300 emails that you are receiving from the community says something. These individuals who, again, have given up their time to be here to make it known how important their library is important. You're questioning $169,000, wondering where Sunday fines went. No one ever wonders how they're funding Exploration Commons. Did you think about that? You haven't given them staff members since they opened Finksburg how many years ago? But there are 8 staff members funding who are there working in Exploration Commons every single day. This teaching us a lesson and saying that started this budget season is not correct. Our budget decreased by over $5 million from fiscal year 23 to fiscal year 24. It is going up. We asked for 3%, and again, I'm not here as a library employee, so I shouldn't say we. The library forewent having a public hearing with you because you had said you would give the 3% that they asked for. No one from the library has thrown anybody under the bus. I cannot say the same thing from the individual standing in front of me or seated in front of me, and that is a shame. The county also made the decision to give county employees or commissioners to give raises to all county employees. That benefit and that same amount was not extended to employees of the library. So for you to say that you are making a point and a statement to library leadership for what you perceive they have done is being heard loud and clear by the 263 employees who work for the library system. That statement is being heard loud and clear by the 171,000 individuals who utilize our library system. And so respectfully, gentlemen, your definition of being a friend of the library is very different than mine and all of those who have reached out to you. Thank you for your time.
Thank you.
John Million.
Mr. Million.
Thanks, Bill. We meet again. Good afternoon, Commissioners. I hold in my hand the original correspondence from October 27th, 1981, titled Upgrading Babylon Road and Bridge, and the follow-up deed, Libra 4, page 103 reads, this deed made the 19th day of November between Darlene J. McDaniels and the Board of County Commissioners, proposed to acquire property for road improvements to Babylon Road for the sum of $0. A 50-foot right-of-way was obtained, 4.370 acres of land between the labeled right-of-way recorded among the land records of Carroll County in the road plat book number 1, pages 62, 63, and 64. Deed page 104, along with the easements cross-hatching for the construction of Babylon Road and the construction of a bridge. Deed page 105 clearly shows the signature of a notary and the president of the county commissioners, and signed by the grantor, landowner, Darlene J. McDaniels. Deed page 106 is signed by the commissioners, the remaining commissioners, the county attorney, the tax collection transfer clerk, the circuit court clerk. I'd say this document has all the bells and whistles of a rock-solid document signed by all the commissioners and the county attorney, also filed in the county records. I did not take note anywhere in this legal document that give the 5 county commissioners in front of me the right to remove the 64-year-old temporary bridge, close Babylon Road's southern access forever, denying me access to 11 more or less acres of my farm between a stream called Silver Run and Mayberry Road. After 64 years of inconvenience in the public, the farmers that can't navigate the 12-foot 2-inch wide temporary bridge, or especially the 10-foot wide, 1,200-foot long prescriptive right-of-way with their farm equipment. The fire department has not crossed this condemned temporary bridge with fire engines or heavier equipment since December 9, 2012, endangering life, property of Babylon Road community. You have owned enough property to fix this public hazard since 1981. So stop telling the public that I won't give you more land to access back to a 10-foot wide, 1,200-foot, one-lane prescriptive right-of-way that you don't own. If I agree to that, I'm also condemning the neighbors to wait for traffic to pass or to keep backing up forever. On this, thank you. This page 1 of this document, as discussed previously, following agreement was reached between you, Darlene J. McDaniels, and the county in return for your granting this right-of-way. So, thank you. I'd say this sounds more like a work order than a deed.
Thank you.
Shelley Young.
Any questions?
Shelley Young. Julie Ford Mount.
actually like to speak for Marty Hankins, since she had to leave early. Is that fine to do that? She filled out a form.
Generally speaking, you can only speak for one, so you get 3 minutes.
I'm just going to read hers. Okay. I watched the recording of May 14th budget hearing alternating between anger and disgust as my commissioner for District 2 continues to denigrate the library and its staff and feels the need to punish them. He himself said he is not a library expert, and that is a quote. And yet he feels he has to micromanage and make better decisions about Sunday hours and library fines than the professional staff and the library board of directors. But now, because of a PIA, Public Information Act report, we find that the commissioner has not been truthful with his constituents, and the library has indeed responded several times to his email questions from a meeting with other commissioners, the library executive director, and members of CCPL board of directors, notably in an email dated April 9th, more than a month before the commissioner's accusation that the library had not responded to his questions. In fact, the April 9th email was sent to all commissioners, the county administrator, the budget director, and the library board of trustees. To me, my commissioner is seeking retribution for what he considers the audacity and treachery of the library to support the Freedom to Read Act recently passed by our state legislature. Again, he is confused by the facts. No library staff testified in the favor of this bill, but Kyler wants to punish the library. As another commissioner said on May 14th's hearing, the decisions made during that meeting will have a severe impact on one of the finest library systems in the state of Maryland, possibly in the entire U.S. These decisions do not punish the library, they punish the citizens of this county. Commissioners have shown he is no friend of the library, despite what his checkbook might say. Thank you.
Thank you.
Yvonne Zeminski.
Good afternoon. My name is Yvonne Zeminski. I've been a Carroll County resident for 47 years, with being a Westminster resident of 36 years. I have the understanding that 3 of our commissioners voted on May 14th, 2024 to withhold funding without stipulations from our Carroll County Public Library because the information requested from the library about collecting fines and opening on Sundays was not received. So gentlemen, please check your emails from April 9th, 2024, which was sent from the Executive Director, Andrea Bursler, and the information was obtained through the Maryland's Public Information Act. She has addressed all of your concerns. Commissioners, if you're attempting to send a message or teaching us a lesson to our beloved library about the Freedom to Read Act and withholding of funds, then as a Carroll County leader, I recommend you leave your politics out of your decision-making, as it is not a leadership quality. It is a vindictive approach, and it will long be remembered when we vote. I strongly urge you that you all reverse your decision from May 14th and fully fund our library. Our libraries are like a crown jewel here in Carroll County and the state of Maryland, and most likely the entire United States. There are very few like our library system that provide the services and resources at a level like no other. And as an older American, I'm a senior citizen, I use a number of the library's services and resources. This summer, I am planning to use more of our library resources with my granddaughter. What will I tell her when the things we want to do are no longer available? Commissioners, what will you tell your people of your districts if the library closes or doesn't have all the programs and services that they're used to because of your vindictive decision? So I implore, reverse your May 14th decision today. And again, what am I going to tell my granddaughter? Thank you for your time.
Thank you.
Martha Hankins. Laura Garver.
Good afternoon, Commissioners. My name's Laura Garber. I'm a resident of Kemar. I am a lifelong Carroll County resident. My earliest childhood memories were story time at the Eldersburg Library. And to this day, I still very much enjoy the hidden jewel of Exploration Commons. When my friends come and are looking for new places to move, I say, please come to Carroll County. The libraries are wonderful. If you go to take a class at Exploration Commons in the morning, there's no parking available. That's because all of the parents are there with their children for story time. The Exploration Commons is a best kept secret for a cheap date night. The cooking classes, I went for a cooking class with my husband. It cost about $10 each. And we made pasta alla vodka and a 3-course meal. It was one of the places where I've learned as an adult that mistakes are okay and mistakes happen. And there's no shame at the library. If we were to lose that funding, that would be the shameful part. Having the safe place, even as an adult, you talk about learning lessons by charging adults fine. It's too late. We've already had those bad habits of, it doesn't matter. That was my parents' job, and my parents tried their hardest. I am a stubborn, obstinate, headstrong girl, as they say in Jane Austen books, which I discovered at the library. I was free to be me. Please don't take that away for future generations. Thank you.
Thank you.
Amber Farn. I'm butchering it. Apologize. Tucson. Okay, Kraus. I should have read that one ahead. Sorry. Forgive me.
I also go by Hannah, so that's fine. Hi, thank you for allowing me time to speak. My name is Hannah Kraus. I'm a resident here in Westminster. I've grown up in the county. I went to McDaniel College, and now I'm a librarian. Not with the public library. I'm actually an academic librarian at a college. So I watched the May 14th meeting, and as someone who has received a master's in library and information science, and could claim to be a library expert, as commissioners here have admitted that they are not, I would like to address the proposed library budget that will withhold money from the library unless they reinstate fines for adults and look into opening on Sundays. So, in addition to the documented information the library has already provided, I'd like to address the topic of reinstating fines as a librarian who has read extensively on this topic, within my profession, during grad school, etc. The American Library Association wrote in a resolution from 2019 that the imposition of monetary library fines creates a barrier to the provision of library and information services. A study conducted at the San Francisco Public Library on fines states, overdue fines do not turn irresponsible patrons into responsible ones. They only distinguish between patrons who can afford to pay for the common mistake of late returns and those who cannot. It is not the library's job to make people responsible, as it's only going to hurt the members of our community who do need the library the most. If members of your community are struggling financially and make the very human error, as I've done myself, of forgetting that their library book is due this week and not next week, do you want to then create a barrier and prevent them from using the library again? We've taken away that barrier. Let's not put it back. Also, as a resident of the county, I'm a taxpayer, I'm a voter. This decision looks to be retaliatory against the library. To quote a statement from that May 14th meeting, it was stated that if the library can't play well with others, saying they badmouth the public schools, then next year more money would be cut. As a lifelong user of public libraries, I remember going to the Westminster Library for so many different events during my childhood as a homeschooler. This horrified me. Cutting more from the public library will punish library employees, it will punish the taxpayers and voters that you have said that you are very concerned about. I know as a librarian that things like databases, ebooks, and library management systems get more expensive every year, as do just general costs and inflation. You're upset with the library for reasons I do not have time, obviously, to address. But this decision that you're making is going to harm the residents of this county that you are concerned with protecting. Please do not do this. I've cited several different studies and documents. I will follow up via email with all of you with citations, as I am a librarian. I always cite my sources. Thank you for the opportunity to speak.
Thank you.
Emily Ann Barker.
Oh, I guess that one was me. Okay, there must have been another Emily Ann.
You're a dime a dozen.
Guess so.
Jeanette Louise Fisher. Jennifer Teeter. Lucas Bowman. Chris Bittinger.
Thank you very much for allowing me to speak. I didn't come prepared with anything. But I am concerned about the library and its funding also. I've been in Carroll County since '85, raised my children and my grandchildren here, love the library, and I understand that there's been maybe some concerns about items or books maybe that people feel that shouldn't be in the library, or that younger children were concerned that they would have access to those. And I thought that when I voted for you guys to represent us, that you would come about solving problems, not causing some of the chaos and problems. My concern is that I'm just a house, I raise my children, my grandchildren, I'm a business owner, I'm just a small person in this community. But I thought to myself, why don't we just do, if this is the concern is about certain books, why don't we do what we did with the videotapes or the movies that they have at the library, where if it has a tag on it, over the age or under the age of 17, you can't check it out. You need a parent, or whatever it might be, if that is the issue. But threatening to take funds from the library, and the fact that these people that work there, they're facing not even getting a raise, I find that extraordinary. When I've looked through some of the stuff that was submitted for the budget, but it seems like everybody else is getting a raise. And I just don't understand that. They work so hard and they provide so much to our community. And I would hope that you would reconsider and provide the funding. And the other thing was working on Sundays. We say they make $26, $27 an hour because, of course, it's overtime to work on Sunday. First, you got to find the people that want to do it. But that's not including all the overhead, the labor burden. So they're probably making $50, $60 an hour by the time you conclude their benefits and all of those costs. And what do they get? Do they get 5 people in the library on Sunday from the time, 1 to 5? Do they get 10 people? Do we know? That's something to look at if that's really a push, because does it pay to pay this? And it can't be one person there. It's going to have to be at least 3 or 4 people there working on Sunday. And so is that really cost effective? And maybe that's the reason. As a business owner, I look at those things every day, so maybe that's why they don't have that happening on Sunday. And if I remember, Sunday's kind of a slow day out here, which I kind of like as a Carroll County person, I remember when we came here and nothing was open on Sundays. Wish we could go back to that, but unfortunately we can't. So I prefer that they weren't open on Sunday. But again, thank you for allowing me to speak.
Thank you.
Nancy Goodwin. Hillary Summers. Suzanne Bainbridge. Teresa Garbandia? My Italian is failing me on that one. Robin Fraser.
Hello, I'd like to speak on the budget today. I want to say that the main point about raising taxes is that taxes are already too high, and I would hope that you would have looked at statistics to kind of give you a sense of this. Population is the driver for government growth. If you have more students, you have to build more schools. If you have more houses, you have more utilities. If you have more people on the road, you have to maintain the roads. But what has happened over the last 20 years is that population has been pretty much flat, just started ticking up just a little bit. But tax assessments have gone up, 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 up. Kind of came down a little, but went back up, way up. Incomes have gone way up. So the income to the county has been going up, 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 but the population has been pretty much flat. So people are already paying too much tax, and if you increase the taxes, especially when they're struggling, and I know you take it down to dollars and make it sound like it's nothing, but $9 million is not nothing, and I hope you won't raise those taxes. You also stated that that you hadn't raised taxes since 1997, the tax rate. Well, that's irrelevant for one thing. But it doesn't mean that costs have not gone up for homeowners, because assessments have gone up and their income has gone up, and they're paying, those are your two big revenue sources, right? So citizens have been paying a lot of taxes over the last 20 years, and trying to say that you haven't raised them since 1997. I don't know what your message is there, but it implies that costs go up. And so we ought to take costs up after all these years. And that's disingenuous at the best. And then I just want to say, so I'm encouraging you still, don't raise those taxes. I learned that, speaking of raises, that you gave the Board of Education raises under blueprint in this year when you don't have to do it until next year. There's $10, $11 million right there. So another way that you could save spending, raising those taxes. And then I just want to say that I'm ashamed of you all for not zoning out illegal cannabis. And several weeks ago, we gave you the answer. You simply put into your code that manufacturing, distribution, buying, selling, using marijuana is prohibited in all zones because it's illegal. And it is still illegal at the federal level, like your attorney said. And you would have, it's an easy answer, and it would save everyone in Carroll County a lot of heartache. So I'm not just disappointed, I'm ashamed. Thank you.
Thank you.
And Karen Suzanne Daniel.
Thank you for listening. I am a parent here in Carroll County. I've been living here for about 17 years, have 4 children that have either gone through the school systems or currently in the school system. And I have to say that the library has been the absolute best place that we have ever found when we moved here. I was a homeschooling parent for a long time as well and loved the resources from our library. And also went back to grad school and pretty much did all of my studying and everything at the library in order to get away from these small humans at my house who were there at the time. And I know that everyone recognizes the value that our library system has. When I talk to people across the country in the many different communities that I'm in, online communities, they are awed and amazed at the programming that is offered here, at the resources, the databases, and all of those things that exist here at our library. And that was before the addition of Exploration Commons. So I also say I do work at Exploration Commons, though I am speaking as a parent and a member of our community. Whenever that space came to open, it was the greatest thing in the world to me because I am a clinical nutritionist, and public education and food education in the kitchen is absolutely a huge passion of mine. But I also do technology. Being able to work with the laser systems, the Creative Cloud applications and stuff we have there are important. And every single week I am asked again and again, have more programs. Can you please do more? Can you please do more? Our programs fill up within seconds. I'm not playing. Today, another one opened. They are full before 9:00:01. And again, people are always saying, can you do more? Now, I didn't realize when I got hired that the funding for these positions, or the funding for opening Exploration Commons, didn't include additional operating funding. I also understand that the commissioners, y'all determine whether or not the library gets additional staff members. The library got no new staff members to operate Exploration Commons. All of those positions that exist there now, which I think I did the math and it's 7 full-time positions, they came from the rest of the system, which means other areas in the system then had to make do with less staff to do their jobs in order for us to have this. Also, that argument about Sunday hours, I read the PIA information from Andrea that stated that they did finally make the decision to use those Sunday hour fundings to help support and fund Exploration Commons. I get we would all kind of even as a parent, and would like to have Sunday hours sometimes, but when I think of the impact it would have on the community, it would take away from hours that are available for other things that we do currently get so many people in for. Also in fines, I agree, which has been stated, you are hurting the people who can't afford the fines. I admit, I was a parent, I paid probably $150 to $200 a year in fines. Did it stop me from being late? No, I was more than happy with the library, $200 in fines. But the people who didn't come in anymore, it hurt them. And we have the ability to not penalize people and still support our library.
Thank you. Is that the last card?
Yes.
Okay, thank you, everyone, and we're now into admin session open. Commissioners, anything?
Well, go ahead. I have one thing.
Yes, ma'am.
All right. So the board asked for, the board is aware that there is I don't know quite what the word is, an opportunity for one of our farms in Carroll County to be the training center for the thoroughbred racing industry in the state of Maryland, and that's Shamrock Farms. You asked for a resolution and a letter of support to be drafted. We have drafted those in hopes that Shamrock Farms wins this opportunity, and so it is in your signature folder here for you. So just wanted you to know that those 2 documents are in here.
That was my question.
Look at that, thank you.
Great minds think alike.
Prescient, very prescient.
Yeah.
Anybody else?
I wish.
Wanda, agenda review.
Good afternoon, Wanda. How are you?
Good afternoon.
Good afternoon.
Good evening.
You're not going to tell Vivian I didn't miss her, are you?
No, I won't.
It's now recorded.
Yeah, you're just on public
Oh,
record.
my gosh. Oh, and I bet she's at home watching. Yeah.
Chris is probably going to do-loop that.
Yes. Okay, Monday, May 20th, nothing. Tuesday, May 21st, 8 a.m., Homeless Services Summit, Carroll Community College, Commissioners Kyler and Rothstein. 9 a.m., Planning and Zoning Commission, Commissioner Gordon. 1 p.m., Board of County Commissioners, open session, budget adoption. We may still be here when that, kicks in. 2 p.m., Veterans Advisory Meeting, Commissioners Gordon and Kyler. Wednesday, May 22nd, Impact Award, Hiring Our Heroes in District of Columbia, Commissioner Kyler. Carroll Community College Reception and Graduation, Commissioners Gordon and Rothstein. And I told them last night that I wouldn't be there, but Vivian also sent something saying that, so. And they didn't seem excited about it. They said, well, is Commissioner Rothstein coming? We're fine. So, yeah, and Commissioner Gordon, so I'm well covered. Thursday, May 23rd, 8 a.m., Board of County Commissioners closed admin, 9 a.m., open session. Item 1 is approval to purchase 2 parcels contiguous to Cape Horn Park. Item 2 is approval to purchase Freedom Park Challenge Course installation. Item 3, 250th Anniversary Committee resolution. Item 4, if needed, backup budget adoption. It won't be, right? Item 5, Carroll Business Expansion Job Creation Funding. Item 6, Carroll County Infrastructure Investments Fund Transfer. Item 7, Carroll County Farm Museum Blue Star Museum Designation. Item 8, contract award for, is it Sunoco? Sunoco LLC.
That's New York for you.
And that should probably say what.
Yeah,
is
but
being
we said that
purchased.
last week. We need more detail.
Item 9, approval to purchase shotcrete linings. Item 10, contract award, site work to prepare for a new pavilion at Carroll County Farm Museum. Public comment, admin, agenda review, 5:30, Greater Baltimore Committee, annual meeting, Commissioner Rothstein. Friday and Saturday shows nothing, and Sunday, it's my week to do the podcast. Any changes, additions?
I will be giving a Memorial Day speech either Saturday or Sunday. I got to double check, and I'll send that to you, Wanda.
And I hope I am too. I need to double check. The second week, Monday, May 27th, county office is closed for Memorial Day.
I will be in Tawnytown for that day for speech. The other day was Pleasant Valley.
And Wanda, I'll be at the Westminster Memorial Day Parade.
Okay.
Thank you.
And I will be in Hampstead. And Commissioner Rothstein will be at Freedom District Lions Club Veteran Day Celebration. Tuesday, 10 a.m., Sons of American Revolution Road Marker Dedication, Commissioner Vigliotti. Wednesday, May 29th, nothing. Thursday, May 30th, Board of County Commissioners, closed admin, Board of County Commissioners open session. Item 1, Mako. Item 2, Community Development Block Grant for Family Shelter. Item 3, spring amendment to,
We don't need that.
We don't
If you
need
made-
that.
You made the decision today, right?
Yes, we did.
Yeah, so that,
Yes.
we don't need that.
Yes, that decision was made, so we don't need that. Request for public hearing, dissolved air flotation storage text amendment. Public comment, agenda review. Closed for land acquisition. Friday, May 31st at 10 a.m., Transition Connection Academy certification, certificate ceremony. Carroll Community College, Commissioner Kyler. Saturday, Hampstead Fire Station, Commissioner Kyler. And Sunday, Commissioner Gordon has the podcast. And at Sunday afternoon, there is an Eagle Scout Court of Honor at the church in Limeburg for Caden Farver. And I will be there. Oh, man. Any additions, changes, motion to adjourn?
Motion, we have to recess until.
Yeah. You're-
Okay.
So until what time?
How
So
long?
We're supposed to start at 1,
2:30?
2:30?
2:30?
2:30?
2:15, 2:30, it's up to
2:15,
you.
2:30?
2:30? All right. Motion to adjourn, motion to recess until 2:30.
Second.
All those in favor?
Aye.
Opposed? Did you hear anything back?